Morning, everybody. Thank you for joining us for Mental Health Advocacy Day. My name is Lori Emerson, and I am the Executive Director of the National Alliance on Mental Illness of Vermont. Mental Health Advocacy Day is an opportunity for us as advocates to raise awareness about our lived experience, to inform legislators about what is working and what we need to improve. Our theme, Mental Health Starts with You, is so relevant in today's world. And as a state, we need to empower our youth and build resiliency as they are the next leaders of our state. This generation has faced significant struggles, and we need to ensure that they have the support, resources, and hope for the future. We need to continue to build an integrated system of care that supports mental health, physical health, spiritual well-being, and those with co-occurring needs. This is our 8th year in joining together as a united coalition with over 57 co-sponsoring organizations this year. And we have invited, and everyone has invited their network and community to be here today. And I thank all of you for your outreach efforts. Collectively, we have registered over 300 advocates, which does not include the watch parties for this event. And if you formed a watch party, let us know by telling us how many people are watching today. Please type your numbers in the chat and feel free to introduce yourself and include any chat messages to share with anybody here today. And we are very excited to welcome a great lineup of state leaders, followed by a keynote presentation by Alexina Federin, Miss Vermont 2022, and sharing stories in the afternoon. And during lunch, we will provide a slideshow with artwork and photos from previous mental health advocacy days. During the week, we'll be providing testimony to the legislative committees for Mental Health Advocacy Day. And I want to thank all of you for attending today, with a special thank you to the legislators who are here. So this event will be recorded and shared with everyone who is registered. We're using a webinar format where we ask that you share comments and information in the chat. If you have questions for our keynote, type them in the Q&A. And please feel free to stay logged into the event, even if you take a break for lunch. If you find that you need support during the event, you can send a private chat to one of the co-hosts with your phone number, where someone will call you back. Or you can use any of the resources provided in the chat. At the end of the event, we will have an evaluation link and it will be displayed on your screen. So we ask that you take a minute just to share your feedback with us. So I hope you really enjoy the day today, and so happy that you're with us. And now I'd like to turn it over to Will Eberly.
Thank you so much, Lori. Greetings. On behalf of the Vermont Association of Mental Health and Addiction Recovery, I'm honored and delighted to welcome you all to Mental Health Advocacy Day 2023. This event is co-led by VAMHAR, NAMI Vermont, and Vermont Care Partners. This day would not have been possible without our planning team, and my deep appreciation goes out to Lori Emerson, Julie Tesler, and Drew Resley for the extraordinary time and effort they all put into making this day a success. I'm also heartened and touched by the support of our community-based partners across the state who co-sponsored the event, shared deeply of their experience and expertise, and helped raise awareness for the event. We have 57 co-sponsors this year, and I don't have to tell you what a heartening show of support that is. Without the contributions of our co-sponsors, this day would have had so much less reach and impact, and we're grateful for each of you. This year, Mental Health Advocacy Day is built on the notion that mental health begins with youth. As a person who experienced significant mental health challenges as a child, youth, and young adult, which culminated in homelessness, substance use disorder, and sustained unemployment, I can assure you this is true. Like so many Vermonters, I cultivated resilience and went on to enjoy a successful and happy life. That became possible when it felt safe to talk about the struggles I was going through, tried different resources, and found the type of supports that worked for me to find recovery and a healthy and happy life. I look back to that earlier part of my life when things were their worst and mourn so many friends who died from suicide and overdose and homelessness, and realize I was lucky to make it. Many people I cared for deeply were going through the same things, responding to the same forms of trauma and hardship, and didn't make it out. I lost a lot of years before I did. Our job here today, together, is to make it safe to talk about mental health, make it comfortable to get help and have real choices in what that help looks like, and to create a Vermont together where all youth, all Vermonters, have ready access to the tools they need to live happy and productive lives. Thank you so much for being part of this day and part of this work. Now, I give you Julie Tesler, the Executive Director of Vermont Care Partners.
Good morning. Thank you so much for joining us today. I also just want to thank the planning group, particularly Lori Emerson, and to the 57 co-sponsors. You really make a difference. I just want to start the day by sharing with you why Mental Health Advocacy Day is so special and meaningful to me, and what my hopes for the today is. For me, the day is the day where we recognize our common humanity, our individual vulnerability, and our sense of purpose and shared value. Over the last few years, we've all been through quite a lot. COVID and increases in gun violence, the impact of climate change, and people are feeling greater anxiety, depression, using substances more. There's just a lot on everyone's plates. And I think we've all grown to recognize that our health and safety can't be fully protected or assured. Our shared reality may have more risks and challenges in it than maybe we previously acknowledged. And our shared reality, as a result of our sense, leads us to a sense, hopefully, a sense of shared responsibility. And for our well-being and for the well-being of our youth. And they are very critical. And that's a shared responsibility we all have to support our youth. And so whether it's caring for yourself, and that's important, or your children, for those you love, for your peers, for people that you work with or people that you're employed to support, we're all holding the shared responsibility. In my belief, that's a gift. It's a gift because we're in community together. And I know that a lot of you have a lot on your plates. So I thank you for being here, participating in this community today. We'll be hearing statements of commitment, stories of struggle, hope, accomplishment, as well as fears and dreams. Let's honor this time. Let's learn from our group experience and use it for inspiration for shared advocacy. We're going to begin the day by hearing from state leaders. So we greatly appreciate that they've carved out time to speak with us. I'm afraid we won't be able to do questions and answers at this point. We will later in the program. You are certainly welcome to put comments or issues into the chat box. Our first speaker is going to be Lieutenant Governor David Zuckerman. He has used his position to actively influence public policy and educate Vermonters on a range of issues, including mental health. In fact, Lori and I together have been on one of his weekly shows. So he really makes an effort to share information about mental health. And we're really fortunate to have someone in this leadership role who is always there to listen to our voices. His door is always open. And so we appreciate that he's here today to talk with us and know that he will listen to us as well. Lieutenant Governor Zuckerman.
Thank you, Julie, and Lori, Will. It's really an honor to be here, and I appreciate the work that all of you do. And Will, I just am so inspired by your story and so many others like you who have worked to get to a better place. And it is so painful that not everyone is able or has, and that you've lost, as you said, many friends, and all of us have lost people around the state to various struggles, and it hurts every time when we think about what more we could be doing to be available, to be there to listen, be there to counsel, be there to help. As a policymaker for a long time, now as Lieutenant Governor, I'm often frustrated when we say in the political world, we don't have the resources, we can't provide the services, we can't provide more space because that is in part a political question. It's a political conversation. And many people think it's at the heels of the Appropriations Committee. But I would say it's actually at the Ways and Means Committee in the House and the Finance Committee in the Senate, where they ask the people of our state, do we have the resources for the things that we really need? And it's always shocking to me when we say we don't have the resources, when there are people in the state who are doing very well, who own phenomenally huge second homes from New York or Massachusetts or California, and they sit empty most of the year, or they could pay more for our education system so that there's more opportunities for counseling in schools for many of our youth. It's very frustrating. And I just want to say to many of you out there that it's one of the ways I've advocated to make change in the process is to ask you, when you're ready, to advocate for yourselves. You have a number of representatives and senators on this call. Many can't be here. But it is amazing what a few calls from each of you can do to help elevate an issue, in this case, mental health, substance abuse disorder, and so on, to be a priority, to be something that policymakers can advocate for in the halls and to across the state to help make things happen. And I just want to say, I want to make myself available, Julie, thank you for the introduction, that my office, the Lieutenant Governor's office on the first floor in the corner of the State House, is a place that you can come and ask us, how do I find my representative or senator? You can ask us in person. You can reach out to us through my chief of staff, Lisa, who I will put her office email in the chat when I finish, but lisa.gerlach@vermont.gov. And we will help you find your rep or senator, navigate the building, navigate the political process so that your voice can be amplified. And I look forward to today. I look forward to hearing Alexina's comments. I believe I met her this fall at the Flannel Festival in Southwest Vermont, if I'm thinking of the same person. But I didn't realize this was really her mission and work. And that just inspires me more as well. So thank you, Julie. I'm not quite sure how long I was supposed to talk, so I don't want to overstay my welcome. But please, folks, do reach out.
Thank you so much, Lieutenant Governor Zuckerman. Really appreciate your support. And I know that it's sincere. Our next speaker is going to be the Speaker of the House, Jill Kowinski. I want to tell you that throughout her tenure as a legislator and her position as leader of the House of Representatives, Jill has shown an ongoing commitment to the social well-being and health of Vermonters. Last year, she heard our cries of distress and worked with leaders in the House to eventually pass an 8% Medicaid rate increase for designated and specialized service agencies and home and community providers. We are most grateful for that, and we're appreciative of having you here today. So thank you very much for being here.
Good morning. It's nice to see you, Julie. Good morning, everyone. It's great to join you for the 2023 Mental Health Advocacy Day. And I am thankful that the lens of this year's event is on youth mental health. Well, Vermont has had a lot of success in taking on the challenges of our state. Mental health continues to be a significant problem for Vermonters, and the pandemic has only made this worse, especially for our youth. Because of the need to mitigate the spread of COVID, many healthcare institutions were forced to triage the services that they were able to provide, leading to delays in individuals getting access to the care that they needed. The delay in care led to an increased mental health emergencies across the state in the number of suicide and overdoses. Mental health care and the access to it is at an all-time high. And I hear that and I see it. Beyond the staggering numbers, the vast majority of affected individuals do not receive or have access to the care that we know that they need to transform their lives and to prevent significant mental health crises later in life. Though we do have a range of interventions that can make a significant difference, it's clear that we need to expand our resources in order to provide care to all that need it. When mental health issues are addressed early, especially in young people, it can significantly decrease the likelihood of major healthcare issues later down the line. It is absolutely crucial that we invest in mental health services and support for Vermonters. Like you heard last legislative session, we made significant investments in our community mental health system, but we know there's much more to do. We need to fill the gaps in our system of care and expand access to counseling and therapy in areas of the state where it's not readily available. Having strong community-based mental health resources, hiring more mental health professionals, and reducing stigma around mental health will aid us greatly in addressing the crisis before us. We have come a long way, but the work to reduce the stigma around mental health still has a long ways to go. Our work here together won't be done until all Vermonters feel comfortable seeking help and support when they need it. I know that we can and we will do this together, bringing all Vermonters, mental health professionals, advocacy groups, and community organizations to the table to have the conversation and ensure that mental health services are accessible for all those who need it. And finally, I believe it is imperative that we listen to our young Vermonters to understand the issues that they are facing each and every day. We can't have a functional support system unless we hear and recognize all the voices that are being impacted. Having spaces like the Vermont Youth Council that elevates experiences of adolescents will go a long way in making sure that we can put the resources and supports in place that will make a big and real difference. Today, as we hear the firsthand experience of those who have faced mental health issues directly, I just urge all of us to listen to those experiences and to use it as a guide to make sure that we are making the change that is needed. The more we understand this critical situation, the more support we can provide in our communities, just like the care that we took of our neighbors and fellow Vermonters during the pandemic. Again, thank you so much for having me here today, and I look forward to working with you to reduce stigma around mental health and increase opportunities for Vermonters to have access to the support that they need and deserve. Thank you, everyone. Thank you so much for all you do, and I have your back.
Thank you, Speaker. We really appreciate that and that commitment to listen and to lead us. We couldn't be more appreciative. Our next speaker is Senator Jane Kitchell. As chair of the Senate Appropriations Committee and a former Secretary of Human Services, Senator Kitchell has dedicated her career to support Vermonters' health and human services. She's also an active leader on the board of Northeast Kingdom Human Services and truly understands the demand for services, the funding challenges, and the importance of investing in a continuum of community-based services as a foundation for our mental health service continuum. Senator Kitchell deserves very much credit for the 8% Medicaid rate increase that we received last year in response to the increasing needs of Vermonters and our workforce challenges. So thank you so much for joining us today. I'm glad that some of you may not have met Senator Kitchell, have this opportunity.
Thank you, Julie, and welcome. It's a pleasure to be with you this morning. Just to give you a little background, I do chair the Senate Appropriations Committee, and so I have a direct role in the funding for our mental health delivery system. I also, as Julie mentioned, serve on the board of Northeast Kingdom Human Services, so I've been experiencing over the last couple of years very directly the challenges that are being confronted by all of you. Prior to being in the Senate, I actually had 35 years in human services. So I guess I can say I've seen the evolution of the mental health system from a very institutional based one to our community-based system. We've talked a lot about the impact of mental health on physical health, and we've talked a lot about the integration of mental health and physical health. But at sometimes that it seems to be more rhetoric than action. I would point out that last year in the governor's proposed budget, there was a 3% base increase for mental health. Working with the House and others, we were able to get that up to 8%. It is rather disappointing that the governor's proposed budget this year is essentially level funded. It's hard to see how that can be justified in this current fiscal environment with high inflation and the workload pressures that are being experienced with systems other than just the state employment system. I know that you're dealing with workforce, and we were dealing with workforce problems before the pandemic. Actually, a couple of years ago, time is a way of fleeting, I had set aside some money from a tobacco settlement to help actually support people in their educational pursuits so that we could build our workforce. But that certainly is an ongoing and actually an increasing dilemma for healthcare providers. The governor's budget does include mobile crisis response and a treatment center. But as I said, without an increase in your base appropriation, to me, it's akin to building more rooms on a house that has a foundation that is weak. And what it does is create more expectations and maybe even in some cases more disappointment in how well the system is functioning. There's another pilot with Blueprint, and that certainly is connected to the integration of primary care and mental health. I also know that FQHCs are getting funding to provide more mental health services. To me, the challenge that we need to look at as policymakers, and I know Senator Lyons is after me, and that is we need to see how these initiatives in fact complement and build and strengthen the system that we have in place and not compete with it, or even worse, weaken it even more. So we have a lot of work ahead of us. The need for services has never been greater. The challenges for our agencies have never been greater. And I think the next couple of years ahead are going to be very, very important as we kind of look at that role and that intersection of other healthcare delivery and mental health treatment. Because I do think we are making a great deal of progress on general understanding of all Vermonters around the importance of mental health, suicide prevention, and the investments that are necessary. So I'm just sharing sort of the things that are rattling around in my brain as we approach this new legislative session, and what is on my mind and what I will certainly be focusing on as we move forward. So I think that's probably my 5 minutes. According to my computer, it's 10:25. So I'm going to say thank you, and I'm sure I'll be hearing from many of you as we proceed with our budget work. Thank you, Julie.
Thank you so much, Senator Kitchell. Thank you for your leadership. Our next speaker is Representative Diane Lanford. She is the new chair of the House Appropriations Committee, but she's also an old friend to Home and Community-Based Services. When she was a legislator who served on the House Appropriations Committee previously, she was responsible for the developmental disabilities budget. She took that responsibility very seriously. She studied our system of care, she went out and visited, and she fought to prioritize funding for home and community-based services. So we're very thrilled to have her as the new chair of the House Appropriations Committee and look forward to hearing your remarks today. Thanks so much for being with us.
Thank you, Julie, and good morning to everybody that's participating this morning. I sound a little raspy. I do have the lingerings of some laryngitis, which may be indicative to how much I talk in this building. I'm currently at the State House right now and happy to join you via this virtual ability. Allows us to be in many places, I guess, at one time, and that's nice. The speakers that were ahead of me today spoke eloquently about the direction and of youth mental health and where and what has happened in the past and what we aspire to in the future. And particularly, I'm looking forward to a year with my counterpart in the Senate, Senator Kitchell, who is a very good friend to mental health and all of the issues there. In the past, not that far in the past, but a few years ago, students had approached me to bring forward a bill that they were interested in seeing passed, or at least a direction. And that was in the development of the Youth Council. And it did take a little while. It took 4 years to get it to pass, but it has passed. And the Vermont Youth Council is now established and is operational, and I believe had their very first meeting in December. And this is a council that represents the youth all across Vermont. There is representation from all the counties, and they will be working to create how members will be appointed to or voted to this council. In the past, we had heard, and it was quite moving to have in this building, the youth from across the state when they brought to us issues that they were very concerned with, which is, was really around climate change and around some of the gun legislation that we moved in the past decade. With the Vermont Youth Council, this is a very constructive way for our youth, 11 to 18, to be able to meet and talk about the issues that are the priorities that are there for the youth. And as a part of that is to speak to the governor once a year on those priorities and for the upcoming budget, and to testify in the legislature. I was surprised when youth came to government ops with Representative Moricki and others. Coach was extremely helpful in making sure that this bill was passed. When they testified in government ops, the youth that filled the room that day and beyond, well, in that room and beyond, I was surprised to hear that their number one issue or priority that they wanted to work on was mental health. I thought that might be in one of their top 3, but I was actually quite surprised that it was youth mental health. So my time is just about up. I look forward to, and I hope that you take a look at the Vermont Youth Council and see where, if there's a place for your voice to be brought in through that configuration. And thank you very much. And I look forward to working with you all this coming session. And I hope many more to come. Thank you.
Thank you, Senator Lanford. You can see that she's committed. If it took a while to get the Youth Council off the ground, she's going to stick with it until she gets it off the ground. And I think she's here to listen to our voices around mental health needs and is very committed to that. So really appreciate having you in that leadership role. Our next speaker is going to be Senator Ginny Lyons. She has been chair of Senate Health and Welfare Committee for a number of years. And when she does that, in that role, she's really taken a very comprehensive approach to health and human services. And she's observed the lack of parity in funding for mental health services and has continually worked with us to encourage the administration to look at our rates, look at our funding, and look at that on an annual basis and recommend increases on an annual basis. It's obviously been a challenge, but she also has stuck with it, and she's there for us to support youth mental health, health integration, substance use services. She is there as a supporter and is open to hearing what people's perspectives are. So thank you for joining us, Senator Lyons. Appreciate having you here today.
Thank you, Julie, and Lori and Will as well. It's really a pleasure to be here. When I look at the range of issues that are before us relating to mental health, it could be overwhelming, but it's also very exciting. The continuum of care has been something that I've been interested in for a long time. And I believe that with our steps in healthcare reform that we're currently taking, we're beginning to see that continuum from acute care needs to community support services. It's really very exciting. I want to share with you one bill that I worked on last year. It was a bill, I only know the number, I don't remember the act. It's S-197, but it's a bill that brought money, grants into schools and a connection between schools and mental health. We know that there are a range of mental health needs today for kids as a result of the pandemic. And as a result, I think inflation is affecting families overall. And so I can see those stresses also continuing our mental health needs in schools and out. But the range of mental health needs is something that S-197 began to cover by offering grants for mental health counselors, for school counselors to support kids. Kids need everything from a simple support, a mentoring program, to psychotherapy. And this bill allowed for application of grant monies to help kids in that way. In addition, the grant program also was directed toward teachers. Teachers were equally affected by the pandemic. And, some of us don't know the lingering effects that are there as a result of everything that occurred. So that bill to me was really very important. And now I look forward to work alongside Senator Kitchell in appropriations and continue our work on the blueprint. I look forward to a bill. I'm introducing a bill on expansion of the blueprint to include more than opioids as substance use in the substance use area, as well as looking at mental health. So expand that program. And then I think as you hear from the Commissioner of Mental Health, you'll hear about the mobile crisis teams, but you'll also be hearing about other grants that will be given out to support community-based services. So absolutely key to keeping people out of the emergency room and in places where they belong, whether it's a step-down bed, subacute services, or whether it's getting folks home when they have a mental health crisis. There is so much that we need to do to ensure that people have safe spaces and safe places, regardless of what level their needs are. So, and as Julie said, let's remember, we all have a shared responsibility. We all are part of this community. And so I'm very excited to work with you to solve some of the crisis that we face, because it is a crisis. Bottom line is having sufficient workforce. We invested in workforce last year, and one of the things that I'm very excited to have done was to recommend putting investment into some of our folks who are studying mental health counseling, and we're paying for some of their studies, which is great. We also have put in place some reimbursement for loans and so on. We, as I think everyone knows, we are in this together, regardless of where we are, whether we're in a hospital, whether we're in public safety, whether we're in the legislature, whether we work in a laundromat. I just read the article about mental health support services in the laundromat on King Street in Burlington. There's a lot going on, and I think it's our responsibility to model the investments that we model who we are and how we respect folks who have mental health needs and how we can help in the positions that we hold in our positions of responsibility. Whether it's, so I will stop there. There's a million things that are in my head at this point, but Julie, I want to say thank you for inviting me today, and please stay in touch. I would like to have all of you, maybe not all at once, maybe through Julie, but I really value your input as we look at legislation in my committee, Senate Health and Welfare, And then as we consider how we improve spending for mental health in appropriations. So thank you all. Take care.
Thank you so much, Senator Lyons. And you will hear from us, don't doubt it. Unfortunately, Representative Lori Houghton, who's chair of the House Healthcare Committee, was unable to come today, and she sends her regrets. But I want you to have no doubt about her commitment to community mental health and to our youth. As a matter of fact, on Wednesday, the House Healthcare Committee, under her leadership, and the House Human Services Committee, under the leadership of Representative Teresa Wood, will be spending the day at Washington County Mental Health Services to learn about services and the supports that Vermonters need to address developmental disabilities, mental health, and substance use challenges. So that's actually unprecedented. So we're really appreciative to all those legislators for doing that visit and learning about our services. Our next speaker will be Secretary of Human Services, Jenny Samuelson. She's responsible as the leader of Vermont's tremendously large and complex health and human service system. She has to address many competing needs, challenges, and she still looks for opportunities. She's committed to ensuring Vermonters in every region of the state have equitable access to mental health services, and we greatly appreciate that. Please join us, Jenny. Thank you.
Good morning, Julie. Thank you. It's great to be here with you this morning. It's a privilege to be able to focus today on Mental Health Advocacy Day. The Agency of Human Services, as Julie mentioned, is focused on ensuring equitable access to mental health services across the state. And I want to also reflect on Senator Lyons' work to really talk about the full continuum of care from prevention all the way up to the highest level of acute needs. Mental Health Advocacy Day for me is a reminder of the strengths, resilience, and struggles of Vermonters, and also all of our year-round efforts, yours, mine, and the agency's year-round efforts to provide supports and services for those in need. As we come out of the pandemic, and as we reflect on the geopolitical landscape around us, we've been facing years of uncertainty and unknowns. For most of us, this puts a strain on our mental health. And for those of us who've been working day to day and who've been responding to the pandemic, it takes us even further. It's important at this moment to take a stock of our mental health, that of our friends, our families, and our communities, because now is the time to take action. And the mental health begins with me and with you, with our communities, and with all of us together. As we've talked about, mental health is the foundation for allowing us each to live individually and as communities to live, work, and play in vibrant and productive communities. It's important to also recognize that for our youth during the pandemic, it had significant impacts on their emotional and social well-being. And yet, as a parent and as a leader, I am incredibly inspired by the resilience that they have demonstrated. It's also a moment to reflect on the fact that our mental health does not present as the same as our physical health challenges and problems. And that because of that, there's been significant stigma over the years. Individuals often feel ashamed to say that they're not okay, but it's important to stand up and say it's okay to not be okay. Over the past 2 years and before the pandemic, our mental health system was brittle, but the pandemic has strained it even further to the point at which it's not able to meet all Vermonters' needs. It also demonstrates the changing landscape in mental health and the changing landscape and the evolution that we need to take in order to meet those needs. Last year, we made significant investments in our community mental health centers. And this year, we're taking a moment to take stock of how our mental health system needs to evolve. And in taking stock, we're making key investments, including investments in primary care for co-occurring treatment, investments over the last year in 988, so individuals have a place to call. Investments in mobile crisis, alternatives to emergency rooms, pilots for assessment and stabilization, investments to stabilize our hospitals and our residential treatment centers, and expansion of adolescent beds, to only name a few, and demonstrating our significant commitment to looking at where the gaps are and to addressing Vermonters' mental health needs. I also want to take a moment to recognize our community designated mental health centers, our substance use treatment specialists and hubs, and our community providers for the foundation that they provide in our mental health treatment system. And yet, we're facing a crisis with deaths from suicide and overdose continuing to evolve in an increasing trend last year in 2022. Those deaths touch each one of us. They're a loss of a friend, of a family, of our neighbors. And it demonstrates the need for us to continue to look at where we can ensure that we are providing co-occurring treatment, holistic, whole person care. It also tells us that people are not okay at the highest levels of care. But it's not just the individuals who we've lost, but it's at that extreme level. But it's important for us to look at the full continuum of care. And so this year, we've taken a look at the available supports at every level. Some of these are in place now, and others represent investments into the future. First, it's someone to ask, to help to prevent. And that includes the expansion of our hub and spoke model in primary care and the expansion of our community health teams to be co-occurring, to ensure, given that we know that individuals who have died of overdose and suicide often touch that part of our system, to ensure that they are not only asking, but providing treatment, supports, and sometimes navigation to higher levels of care. Second, it's someone to call, including the 988 Suicide and Crisis Prevention Lifeline, which is for individuals who may be in crisis or for someone who knows someone is in crisis and needs additional support. It's the crisis text line, and it's the Pathways warm line. Third, it's someone to respond, which includes mobile crisis, including a credentialing peer support staff. It's our designated and specialized services agencies who are there for people in need. Fourth, it's somewhere to go. It's youth inpatient facilities across the state and stabilizing those. It's adult residential facilities. It's evolving to include new systems of care, including psychiatric urgent care and other alternatives to our emergency departments, recognizing that our current systems need new investments. It's ensuring that our child residential providers are strengthened and that our micro residential providers are there. So again, it's someplace to someone to ask, someone to call, someone to respond, and somewhere to go. And we're building a way for people to come, for services to come to you, and for a place for you to go. So in closing, I'm excited to work with you. And that as an agency and as providers, it is incumbent on us to evaluate the needs of Vermonters, willing to recognize that those needs have changed over time, and to be willing to try bold new things and make appropriate investments therein. As individuals, it's up to us to tap into this and ask for the supports that we need. It's up to us to ask our friends, families, and neighbors to really check on them, and for our communities to offer our help and to be good neighbors, and to take a moment to care for ourselves and to care for each other. So I look forward to working with you over the year and continuing to advocate for the needs of Vermonters.
Thank you so much, Secretary Samuelson. You can really hear the breadth of work that is being done at the agency to support youth mental health and the mental health of Vermonters. We really appreciate it. Our next speaker is the Commissioner of Mental Health, Emily Hawes. Emily has worked her way up through the mental health system and really understands the complexities and the challenges that Vermonters face with their mental health. Her team at the department are working creatively with peers, advocates, and providers to strengthen our system of care, which includes health integration, co-occurring services, improving and utilizing our peer network more. So there's lots of positive work happening at the Department of Mental Health, and I'm sure Emily's going to share that with us now. Thank you for joining us.
Thank you, Julie. Good morning. Like my introduction said, I'm Emily Haas, and I get to be the Commissioner of the Department of Mental Health. So thank you for having me back. I had an opportunity to talk with you all last year, and it's a privilege to come back, especially as we start to move some big initiatives forward. So when we think about mental health or mental well-being, you know, this is something that we all have. And our goal is to support a system where people who want supports can access it when and where they want it. And so this goes for folks across the age spectrum. And we will continue to engage with all of our stakeholders to help the system meet those needs. You've heard, obviously, a lot of folks brought up the pandemic this morning. And there's times when I think, gosh, we can't talk about the pandemic and its effects enough. And then at the same time, we talk about it too much. So I just want to acknowledge, as we all look forward towards a new normal, and at the same time, mourning what we knew was our normal a couple of years ago. Our team at the Department of Mental Health, along with your advocacy work, is working tirelessly to strengthen our resources to address the critical needs of all Vermonters. You mentioned, Secretary Samuelson mentioned our 988 crisis, suicide and crisis prevention lifeline. We want folks to be reaching out if they are in need to that line. We also want folks, if they would also prefer, to reach out to peer support crisis line, and then also our crisis text line, and we can make sure that folks have access to those numbers. But you'll see that theme, that we want individuals who want and need support to make those calls so that they can get connected. Without our agency staff, our frontline medical staff, and the community of active mental health advocates, we could not provide the help needed for those in our state who require assistance. We also understand that not every approach works for all folks who are experiencing mental health challenges. So we operate, operating from a lens that folks should have access to care when and where they need and want it. We're excited to bring some of those system suggestions we have received through engagement with key stakeholders, like some of you here, to fruition in the future. We're excited about our mobile crisis teams, including peer supports. We're excited about expanding access to psychiatry through telehealth and primary care and emergency departments, our peer certification avenues, opportunities for expanding psychiatric urgent care models, and then, of course, working across the Agency of Human Services and the broader healthcare system to support individuals and families. Now, those are all big policy and system initiatives, but bigger than that, it is also important for all of us to recognize that mental health starts with each one of us. So taking care of ourselves, asking for help when needed, checking in with your friends and neighbors, and helping to break down the stigma around mental health. When you do reach out for support across the system, including our 24/7 supports, this help should come with zero judgment. And we're lucky to live in Vermont, where each one of us can help and provide support. Being in touch with our neighbors, our colleagues, and friends can make all the difference. It's the advocacy community in particular who deserve much of the credit for your work in breaking down stigma while spreading awareness. And just like with our physical health, anyone can experience mental health challenges and benefit from that support. And so we encourage all of our community members to continue their advocacy work. The department and AHS, we're here to listen and to work and to do all that we can to make sure individuals of all needs are supported and cared for. So thank you again for having me here today. And I look forward to hearing the rest of the speakers and enjoying the rest of the week.
Thank you so much. We appreciate your leadership. We have, we're going to hear from just one final person, and that is our keynote from last year, who is now Congresswoman Becca Balint. She's not able to join us in person, but she did send a brief video for us to share with you, and we'll do that right now. So hang in there. Here it comes.
Hello, I'm Congresswoman Becca Balint, and I'm very excited to join you all for Mental Health Advocacy Day this year. I'm one of the millions of Americans who balances day-to-day life with managing my depression and anxiety. And when I first started talking about that, it wasn't always welcome. But I know we must speak our truth about mental health. That's the only way we are truly going to end the stigma and get the help that our communities need. Our country's mental health crisis has only grown since the pandemic. Economic downturns and isolation made it all the more challenging to address our own mental health concerns. We're also experiencing a crisis of disconnection and loneliness. Now about 4 in 10 adults in the United States report symptoms of anxiety or depressive disorder, which is up from 1 in 10 adults before the pandemic began. Let's be honest about our struggles so we can really address the issue. Increasing access to care, expanding prevention, treatment, and recovery services, and promoting integration will all be key to supporting anyone who is struggling. We need universal comprehensive health care, and that includes excellent mental health care. Our bodies don't stop at our necks. Addressing our mental health crisis will be a top priority of mine, and I'm ready to get to work.
Well, I hope that I'm kind of happy to end on a note from our Congresswoman. So I hope that gives you some sense of inspiration and encouragement, hearing from our state leaders about how deeply they care about the mental health of children, youth, adults, and families. At the same time, we must recognize as a community that we have not achieved mental health parity, that we are all experiencing challenges in our mental health more acutely than ever. The services that we rely upon are under-resourced. While we greatly appreciate the 8% Medicaid rate increase, and we really do, what that resulted in is it stabilized us from a downward spiral. We still have over 1,000 children, youth, and adults waiting for community-based mental health services. And too many children and adults and youth are ending up in crisis, sometimes in the emergency departments for days. The governor's recommended budget, as Senator Kitchell mentioned, while making investments in new mental health services, fails to address the crisis in the existing services. It level funds the designated and specialized service agencies and other home and community-based services. So last year, 1/3 of our staff left. This year, October 1st, when we last measured it, 20% of our mental health service positions at designated and specialized service agencies were vacant, and over 24% of the developmental disability positions were vacant. So some agencies, some programs have vacancy rates of over 40%. So what does that mean? It means that people can't get the services they need when they need them. Children are going out without support to manage in schools. People are waiting for a supported place to live and don't have a place to live. People are turning to hospital emergency departments when crisis beds are so understaffed that they can't take them in. Level funding during a time of inflation effectively means a cut in services and a cut in support to staff. Our health benefit costs are going up, fuel costs are going up, housing costs are going up, and meanwhile, the salaries of other healthcare workers, school employees, state employees, and people working in the private mental health sector will go up. So it's not just inequitable, it's also unsustainable, and I would say risky to expect that this system of care continue to meet the growing needs of Vermonters in this circumstance. When Vermont deinstitutionalized the Brandon Training School, Vermont State Hospital, the Week School, there was a promise made. Promise was that community-based services would be put in place and sustained over time to meet the needs of Vermonters. And that's just not happening. So what can you do? This is about advocacy. You need to call, email, visit your local legislators. They're home on Mondays and weekends. You come visit them at the State House. Lieutenant Governor Zuckerman will show you around. I will be glad to do that. You all have at least 2 or 3 representatives and senators that you can contact. And remember, their job is to represent your interests. That's why they're there. Tell them your story, and we'll be hearing some of those stories today. Tell them about whether you've used services, a family member has, a peer, what it's like to be a worker. You may also share information from our fact sheet, and it's going to be put in the chat, or you can look on the Vermont Care Partners website. NAMI Vermont has a fact sheet as well. And if you're feeling a little iffy about this whole process, Vermont Care Partners actually recorded a webinar just a couple of weeks ago or a week ago that kind of gives you the basics of legislative advocacy. You're welcome to contact me directly too, or your local agency or advocacy group. Because the only way we're going to succeed this year in getting higher funding is if legislators hear from our community at large. We need to help them see mental health as a priority, because they're juggling lots of priorities, from childcare to our environment. There are a lot of challenges out there. So we need to come together in community and have our voice heard. So Vermont Care Partners is going to be recommending a 10% Medicaid rate increase this year. And that's what we need. We actually don't want to stay level. We want to get better. We want to fill those positions. We want to meet the needs of our communities. So now is the time, and appreciate your support, and I'm here to work with you. At this point, I'd also like to turn the program over to our keynote speaker and to Lori Emerson, and hopefully that will give us some more inspiration, because we need it. Thank you.
Thank you so much, Julie. And before you turned off your video, I just wanted to thank you, because Julie is a tireless advocate in the State House, hoping to get that 8% that everybody received. So I just want to say thank you, Julie. You know, we really appreciate you and all your hard work as well.
Well, thank you. But I also just want to say that we wouldn't have gotten that 8%, and I should have said this sooner, without the advocacy of people who use services, people who work in our system of care. It's only way it works is a team effort, all the voices. So, and we had many voices last year, and I really appreciate all the work and effort people put in. It's not easy to ask for support, and people did it. So thank you for that. And thank you to our legislators for listening.
Yes, thank you for mentioning that, Julie. It is a team effort. So now I am so honored to introduce our keynote speaker for Mental Health Advocacy Day. And we want to encourage everyone to type in their questions in the Q&A bar down below for Alexina. And Alexina is a business owner, mental health advocate, and Miss Vermont until April of 2023. And as a teen, Alexina struggled with anxiety and depression for many years, was afraid to seek help because she felt she would be stigmatized. She is a 2019 graduate of Cornell University, where she studied interior architecture. Her thesis research examined optimal design for behavioral health facilities. During the pandemic, she founded Designs by Alexina, a branding studio that works with women-owned businesses in the lifestyle and beauty sector. She is currently working toward her Master of Fine Arts in Graphic Design at Boston University. During the pandemic, mental health issues skyrocketed, especially for teens, and she created a Feel Better Way to inform teens about their mental health. To accompany the book, Alexina created a K-12 mental health program series called Speak Out, Reach Out. She's visited schools all across Vermont to speak about her lived experiences. healthy coping strategies and resources available. So please join me in welcoming Alexina with her presentation, Kids Are Not All Right.
Thank you so much, Lori, for that introduction. And thank you for everyone who has shared their stories, shared their experience. This is, although brings up a lot of traumatic experiences for a lot of people, I think it gives us a lot of hope for the future. So today I'm going to be talking a little bit about my lived experiences, the nonprofit that I founded, and the work and the findings that I've had after talking to over hundreds of students in Vermont and students from K through 12. So Mental Health Advocacy Day is meant to create a focus around the importance of mental health issues through personal stories, observations of the mental health in our communities, and findings through leaders in our field. I am here to share my journey and my struggle through mental health and my observations as a mental health advocate of what's really going on with our students. So I grew up in Bennington, Vermont in a low-income, single-parent, animal-loving household. I started at elementary school and was excited to be able to meet new friends in the area and learn. I was diagnosed in my second year of school with a neurological disorder called cross dominance. Being right-handed and left-footed, it meant that it affected my reading and writing comprehension. But my own pediatrician, who was also cross-dominant, assured me that I was smart and I just learned differently. Without a dominant side to my brain wasn't able to store and retrieve information as efficiently as everyone else's. So I developed many more synapses than my peers to retrieve in order to learn the same information. My peers, however, weren't as reassuring as my pediatrician. I was bullied all throughout elementary school, and I was mocked for having trouble reading and called derogatory names like retard and stupid. Slowly, I started to believe them. Reading circles became my worst enemy in class. Cross-dominance had given me a reading disability where my brain autocorrect some words, substituting random words from the beginning that started with the first two letters. I would either try to go to the bathroom or when it was close to my turn, or just be there for kids giggling when I mispronounced the words. I started feeling embarrassed more and more in class. I wanted to be accepted one day. Looking back, this was one of the first catalysts to my anxiety. The fear of being told I wasn't smart enough kept me up at night in elementary school, for goodness sake. I wish people realized how bullying affects students' mental health. For a while, I tried to ignore the fact that I felt alone. There were years of not being invited to birthday parties with a classroom of 15 students. One year, my mom was even told by a mother that I wasn't on her daughter's approved list of friends. I began to realize that feeling ostracized was my new normal. However, in 5th grade, I thought a new school meant a new fresh start. The beginning of middle school was a chance to start fresh. I worked really hard to prove to people and myself that I was smart and I was capable, but this seemed just to give peers another opportunity to bully me for trying too hard. I thought I would find friends, but I realized it just meant new cliques would form. And the mean girls that bullied me in elementary school were still an issue. They spread rumors about me being poor or being weird, and now other people began to bully me. I remember feeling like I didn't belong, and I created my first unhealthy coping mechanism. I figured out that if I excluded myself, no one else could ever do it to me. This mechanism was a means for survival for me, but I began to bottle up all of the feelings of not being accepted and to think that that was not okay to feel. Middle school is where I first showed signs of depression and anxiety, but I was so good at hiding them that only I saw those signs. Had I heard someone talk about their struggles with mental health, I would have reached out for help. I just had no idea that I was depressed or anxious and that those were what I was feeling and what I was struggling with. And I was just convinced that I was broken, but I hid it well enough that maybe it would just go away. During high school, I mastered my skills of school survival. From the outside, I was a friendly and bubbly person who was eager to meet people who might accept me, but I was really open for rejection. I began to channel all of my energy into being the best person I could be, the perfect person. For me, this was being a perfect college applicant, so I could get out of my small town and start fresh and start new, where people who didn't know me. I was involved in any extracurricular activity that I could think of, even Spanish Honor Society, which I wasn't very good at. And I worked so hard to be an athlete, to be a cheerleader. We actually won our state championship freshman year. I began to start SAT prep in freshman year of high school, which is pretty unusual. I petitioned to get into AP classes, even though my standardized test scores were low because of my reading disability. I would get up early and I would stay up late. I would even take caffeine pills to stay up throughout the day. I worked to maintain those straight A's and was second in my class, but I was exhausted, and this perfectionism just fueled my mental health struggles. High school is a time of so much change, and it can be really scary. I found it harder and harder to hide my interior struggle of mental illness. So I found that self-harm is my new mechanism to cope. I would do it in spots where no one could see. I used magic erasers, my nails, and balls to continue to bottle up all those emotions that I didn't want to feel. During my junior year, my mom noticed me hurting myself and took me to a doctor. I was furious that someone had actually noticed, but inside I was happy that someone finally cared enough to see that I was struggling. I was put on my first antidepressants, and it really helped. I felt kind of normal for the first time in years. I got into the school of my dreams, Cornell University, and I started my new normal where people didn't know where I came from. My roommates became my best friends, and although school was really rigorous, I was successful and no one could take that away from me. You'd think that my mental health would be good considering how much I was finally able to accomplish, or at least that's what I thought. In middle school of freshman year, I started feeling some of those same thoughts of anxiety, self-doubt, and stress, even though I was perfect now. I called our school medical center and asked for mental health resources. After an evaluation, I was told that I was really good at coping well, and that the high volume of students, they wouldn't be able to see me, and I wouldn't be considered for help. I felt confused, so I called my doctor in Vermont, and she upped my antidepressants. I worked for a little while, but I began feeling anxious and depressed all the time. Most of my mental health offices are understaffed and overloaded with months-long waiting lists, so many students give up just like I did. Sophomore year seemed amazing. I got into the sorority of my dreams, and they picked me to be in their class. Some of my best friends got into the same sorority, and I was even invited to amazing parties. I was excelling in my major. I was perfect, but I didn't feel it on the inside. I would walk over gorges in Ithaca and think about jumping off. I didn't want to die and I didn't want to jump off, but I just kept thinking of ways that I could kill myself. One day I was so overwhelmed with those feelings that I decided to give it a try. I tried to overdose on my medication. I remember waking up in the ER and my heart felt like it had stopped. I was terrified. Once I was stable, I was brought into a room. It had a bed with no blankets. It had no windows. It had no door handles. It had no trash bag in the garbage. And I was just so confused with this foreign room that just reminded me why I was in there. My mom and my boyfriend were interviewed about me. I was interviewed, and I was told that they were going to admit me into a psych ward. I would have to take a break from school, and I wanted help, but I didn't want it like this. If I had stopped school, I would lose my scholarship. It would ruin the perfect life that I had spent years trying to create. Somehow I convinced them to let me go, and I promised them that I would get help, and they set me up with services in the same place, ironically, that turned me away a year ago. Ironically, I was turned away for coping too well. And so many students who struggle mentally and either cope well or mask extremely well are turned away from help, even now, and especially now. I made a promise to myself and my doctor that day that for 1 year, I would try everything in my power to get better. I got a therapist, I got a psychiatrist, I got a nutritionist, I joined a mental health group on campus, and little by little, I started feeling better. I even changed my major direction. I started studying healthcare design, and I even minored in it. I also started an honors thesis where I researched behavioral health facilities, the same one that I would have been put in a year ago. I knew that design could make a difference, and I knew that healthcare could benefit most from it. That promise changed my entire life, but it was not all uphill. I still struggled. I struggled with my depression, I struggled with my anxiety, but I knew my limits when I needed to reach out for help. I still struggled finding services and was let down repeatedly by the healthcare system. I was turned away from services for not being severe enough. I was on month-long waits, one that was 9 months before I was able to be evaluated. And I was told that I would get help sooner if I had checked myself into a facility, even though I was not suicidal. But through all of this recovery, I realized that I could do something with those who struggled with mental health just like me. In my group of friends, I'm known for the person that reminds everyone to take care of their mental health. Secret Santa, they will always get a mental health book or a mental health motivational piece or something of the sorts, because I am someone who knows that you don't have to look mentally unstable. You don't have to look depressed or anxious and still be struggling inside. And I always check on my friends, constantly reminding them and encourage them to go to therapy. If you aren't in therapy or haven't given it a try, 10 out of 10 recommend. And try to exercise to de-stress, try to talk to professionals, and try until you find something that works for you. There's so many options and so many ways of holistic care, but a lot of times when we don't succeed the first time, we give up. And I encourage you and everyone listening and all my friends to try again. While attending my first year of graduate school, I was given a project assignment that I took very seriously. As you can tell, a perfectionist doesn't ever not take anything seriously. But I created a publication for little Alexina. I remembered seeing pamphlets about depression in high school, but I was never inclined to pick them up. I mean, I didn't want anyone to know that I was struggling, and a trifold with someone crying on the cover was not very subtle. I didn't want anyone to know I was struggling, and that was just a cry that I was struggling, and another way that someone could bully me for being different or struggling. I felt like it had taken me years to understand what mental health was, what it meant when I was mentally struggling, what it meant when I was happy. I couldn't decipher the difference because I was never given the tools, and I didn't know what was happening in my brains. And in my brain, I don't have two. I wish I did. And that meant that for my mental well-being, I know what I needed to get help when I was younger. And I wish I had known all that information that I put in that book much sooner. The book I created was meant to be a welcoming book for students about their mental health. I wanted to create something that didn't scream self-help book. I wanted it to be small enough to fit inside of a pocket or a backpack. I use graphic design, my graphic design skills and copy choice and a unique, authentic voice to share everything I wish I had known as a teen struggling with mental health. I worked with professionals to ensure the information was accurate and helpful. By the end of it, I had a finished book designed for students, and I couldn't just end there. Fortunately, I was selected as Miss Vermont in 2022 in April, and I gained a site-wide platform to be able to advocate for teen mental health. I made teen mental health my focus of my social impact initiative, and I've formed partnerships with the Stratton Foundation, the NAMI organization, and other schools, being able to visit after-school programs and talk to them about mental health. Both NAMI and the Stratton Foundation are providing funding to print enough books and copies so that I can distribute them to schools and after-school programs. I have met hundreds of Vermont students, elementary through high school, all ages, all types of people. And to paraphrase The Who, the kids are not all right. They are stressed out to the max. After 2 years of COVID, which I know we've all mentioned, they lost a lot of their built-in support systems. Home may not have been an enjoyable place for so many. As someone who is a daughter of a mom who's a teacher, I saw firsthand how hard it is for students to focus, how their home life situations may not have been great, and how they might have rather been in school than at home. Coming back into after school of months of virtual learning meant that so many of them were academically behind, struggling to acclimate back in this traditional classroom. They are also in a time where their success metrics are all around them, and many a times they determine their future, or so they are told. Not to mention the constant onslaught of bad news on TV, phones, laptops daily. There are so many of them under pressure, and they do not have enough support to cope. The statistics are horrifying. 36% of American teens are struggling with depression and anxiety. 75% of college students are struggling, but yet only 30 of them actually receive help. 11% of college students intentionally cut, burn, or bruise themselves, and 9% of those students attempt suicide annually. And every 100 minutes, a student takes their own life. But the truth is, there are so many more who are struggling, who don't speak out, and those numbers are probably underestimating the true extent of this problem. I have had so many students come after me after I've spoken and say that it was the first time they felt like someone finally got them. They felt like I got it, and that no one else had explained mental health and felt like they weren't alone for the first time in their lives. And it's horrifying to see how much hasn't changed in the school systems. I have also heard from parents, many who ask about advice of mental health services. They tell me about 8-month-long wait lists of therapy. One mother told me she actually moved out of the state to get mental health resources for her child. We need more mental health professionals. Maybe extend student loan forgiveness for mental health counselors who work in high-risk areas. We need more funding for mental health professionals in schools. We need to talk openly and dialogue without judgment about mental health issues so that they all feel free to ask for help without worrying about being stigmatized. We need to make open discussion of mental health issues a standard part of health curriculum in every school in Vermont, in every school in America. Because when we normalize talking about depression and anxiety and mental health struggles, it validates the students who are feeling like they are alone, and it encourages them to reach out for help. Thank you.
Wow, thank you so much, Alexina. I'm seeing a lot of love coming up through the emojis here.
I made that through without crying this time.
What an incredible, moving story. Thank you so much for sharing. Why don't people just continue to pour out those heart emojis? Alexina, I'm Drew Resley. I'm with the Vermont Association for Mental Health and Addiction Recovery, and I'm so pleased to get to ask you some questions from the audience. So let's just give it a minute and people can keep pouring out some of the love here. Lots of affirmations coming through the chat. And please, to the full audience, add your questions to the Q&A and I will pull from there and invite Alexina into conversation with us. So I'm just gonna give it a minute and we can all breathe together.
So nice to meet you, Drew.
Likewise. I can't imagine a more sort of perfect keynote that you offered us in consideration of youth mental health. And your story is so powerful and your advocacy now is so powerful. And it's a blessing for all of us in Vermont that you're using your platform in this way. So thank you. Okay, so I'm going to invite some questions. And I think something I'd like to just echo in my own experience is that listening to you, it's hard not to think about, you know, youth in my life and I'm sure for the rest of us, youth in our lives, or if there are youth on the call today who have been struggling over the last couple of years in particular in the way that you described hearing from Vermont students. So thank you for opening up that opportunity to reflect about individual people. And I just invite everyone to sort of hold with care the young people who may be coming up for you as you were listening to Alexina. So I'm going to move into asking some questions. Feel free to take it wherever you want to. So here is one from Janice, who's wondering what informal supports or systems were particularly helpful to you in your journey.
I think the most helpful services, and it's interesting because when I was younger, I probably would not have admitted that they were helpful, but looking back, they really were people checking in on me. And I know it sounds trivial and we all say check in on our friends and family, but one of the things I'll never forget is my mom, who was also struggled with depression before she had me. And when she had me, she constantly reminded me, I'm here for you. If you don't want to talk now, that's fine. But leaving that door open and having people in my life say, I know you've been a little absent. I just want to let you know that I'm here for you. And I remember my roommate after my attempt, she messaged me just saying, I feel so bad that I didn't know that you were struggling that, but I just want you to know at any point, I'm always here for you. If you want to talk now or if you want to talk later. And even if I never talked to that person about that, having them come up to me and say that was just encouragement for me to realize that I had people in my life who cared, even if I didn't realize it. I think a lot of people who struggle with mental health feel alone. I mean, we have all of these thoughts in our heads. We all do. And we all struggle with feeling self-doubt, feeling anxious, feeling stressed. I mean, it's hard not to be in this economy. I mean, there's so many stress factors, but knowing that you have people in your life, those informal help sectors made a huge difference in my recovery.
Yes, thank you so much, especially in what you shared earlier about how sometimes the outer appearance of the work you're doing to cope with your mental struggles are presenting the appearance of everything being fine, and it being difficult maybe for some formal supports to see you in your suffering and how to make the connection. And so the informal supports in your life being able to move beyond and in between some of those appearances. Thank you. I have another question for you that is related. This comes from Marla. What would you say to kids now? Probably what have you said, given all the conversations you've been having about how to deal with bullying and self-esteem?
It's so, I mean, going into schools at first, I was assuming a lot of things. I was assuming that some of the things that I experienced would probably still be there. I assumed there would also be new issues that I had no idea about. But one thing that I think presented to me is that it has to be better, right? It has to be more accepting. And I think we as a society have become more accepting in a lot of facets. But those same struggles in schools still exist. Bullying is a huge problem. And I've had students who come up to me and tell me horrible stories about their experiences. And one of the things that I tell students is that, especially in Vermont, you're in a really small pond. And these people who think they're big fish, who say terrible things about you, who make up rumors, are really little fish. You're in a small pond, and this idea of whether it's moving out of this pond in your area, your town, or your state, I think the idea that leaving can be really reassuring, and leaving can be a lot of different facets. It can be moving to a different town. It could be finding friends outside of school and finding organizations that you may not have run into these people at all, or maybe you see them every day in the hallways, but never talk to them because you weren't sure if they were a safe person to talk to. Mm-hmm. I think that can be really reassuring, and something that helped me and my mom told me when I was younger, is that also it gets better. And I know that sounds, I mean, who would believe a person, anyone telling a kid that it's going to get better? But sharing my experiences and letting them know that, like, all of those negative things that were said about me have made me so much stronger as an individual. Although it hurt me then, when Kelly Clarkson, what doesn't kill you makes you stronger, really is true. And the last thing I think I say to students that I have at least received feedback that makes a difference, is letting them know that I'm here for them. I always give out my social media, and I say, if you ever need to talk to someone that doesn't really know you, or, you know, is a safe person that you've met, that you're like, hey, I at least know one person will listen to me, I am here to be that person. I realize that that's probably a lot to put on myself, but it's something that provides me I'm there for them. And I very much enjoy that role as Miss Vermont, is to be there for students who feel like no one else is in their court.
Wow, thank you for that. Two questions come up related that were in the chat. And I think, and I'll sort of say them both, and you can take it where you want to go. And, you know, you mentioned social media briefly as a way of connecting. And one question that came up from the audience is, what impact, and I know this might be multi-layered, but what impact do you think social media like Facebook or TikTok or Instagram has had on youth mental wellness? And then maybe a related or perhaps separate, but something you brought up question is around what you think are strategies that could help to reduce or eliminate bullying in Vermont schools. And maybe another way of getting at that too is, can you kind of imagine what it would look like to be in a school setting that really had prioritized creating conditions to see all students in their mental health? So question around social media and the impact it's had or could have on mental wellness for youth. And then another, like, what could a school environment look like that really did sort of prioritize seeing all students in their mental health and to reduce bullying?
Yeah, that's such a good question, because I think social media, especially for teens and young adults, is at their fingertips 24/7. And I say with anything like sugar or bread, It's like there are pros and cons of everything in life. Being from a small town, pros and cons. And so I think social media is not, is still subjected to that idea that social media can be a great way to be able to connect with others. It can also be a way for others to make fake accounts. I mean, I remember social media when I used it was only Facebook, and I would get fake messages, well, real messages from fake people, continuing to bully me of things that were said in school. And I don't think that has changed. So I think one of the great things is that it connects people. I remember when I started competing in the Miss Vermont organization as a teen, I met young women from all over the state, all over the country. And I was like, for the first time, I felt like I could reach out to someone and have a friend on social media. And so having that ability to contact them, especially back when I was younger, was like mind blowing, and really helpful for me to know that like Riley in Missouri is always there for me, and I can message her and we can share silly videos back and forth about cats doing weird things. But the con of it is that you are always, and I say you as a collective, are always under scrutiny. Even us as adults, we always see social media as a way to be able to see this perfection. And I think that's something that I struggle with, but I think a lot of other teens do too, of why don't I look like that? Why doesn't my skin look like that? Why doesn't my body look like that? I want to be her. She seems so perfect. And I idolize people even without social media, of wanting this perfect life. And I think social media has so many false narratives and only shows the good side of what someone wants to share. And so one of the things I've tried to do with my personal social media, my social media for my business, as well as my social media for my nonprofit, is share the things that people normally wouldn't share. And it might be uncomfortable. I've shared videos of one of my OCD habits of anxiety where I pick my cuticles. It's disgusting. But to know that someone else struggles with that can be so reassuring and so refreshing. The other question about seeing schools that are implementing and prioritizing mental health. One of the things that I've seen, a school that I visited with NAMI, is that they had their own room available for students to go in, and it wasn't a library. It had a teacher there who was just there to like look over the space and make sure nefarious things weren't happening. But it was a space that students could leave. It was their wellness room. I found the bathroom to be my wellness room because there was no wellness room. So I, think those kind of spaces can be really helpful. I think also, having counselors is so needed. And I know that, there just needs to be more funding. There needs to be more job opportunities. There's a lot of things that we're seeing in issues of healthcare. And I think mental health suffers greatly, especially in schools. And I know students who have told me when they have a counselor that they can talk to, they feel like they just have someone who can listen to them. And I've been told by students, my parents don't get it. They think I'm crazy, or they just think I'm being dramatic. And to know that I have someone, Sally, as a teacher who I can go to is just so nice. And I think those are two small things. Big things in the long scheme of things, but small things that show schools prioritizing mental health. But I would also say, and another thing that I haven't seen that, maybe I would see it if I was in health class, but health class when I was in there was about sex ed and it was about nutrition. There was no talk about mental health. I had no idea what depression or anxiety was in high school and middle school, and it was never talked about. And I think that is a space that can be an opportunity to educate students where everyone has to learn it, whether you want to or not. You can roll your eyes and say it's silly, but that one student in the back who's finally saying this lines up, like I feel like this is me. That I think would be the best way to, in a curriculum standpoint, make mental health a priority, because we do our physical health. I remember in school, the nutrition facts and having an apple every time you had lunch. All of these things are kind of drilled into us as students to eat healthy, exercise. But when have we ever talked about taking care of our minds and what that actually looks like? Therapy, drugs as a medical form to be able to help students, and what the effects of things like marijuana and other drugs that people can get are not helpful. No one really talks about that. And maybe they do, and maybe I'm blind to it because I'm not in that health class, but that's one of the things that I would see as a benefit, and places where schools could get involved.
Wow, such great and specific suggestions. Thank you for that. And I think I have maybe a follow-up question here, which is, it sounds like some of those strategies that you just offered were coming from some things you had actually seen and felt like, wow, this would have been really helpful for me. Are there any stories that you haven't shared yet that you'd like to, that you've kind of seen as you visited schools and talked with so many students? Are there any sort of stories or observations that really stick in your mind? And then we've got a related question in the chat too around how you started visiting and speaking in schools. It seems to be a dream of some other people as well to be able to go to schools and talk with students and offer some support. So anything you might want to share about how that journey started for you too?
Yeah, so one of the stories that will always stick with me that I think Vermont uniquely maybe doesn't hear about as often is race as a topic. And as a topic, as a mechanism for students to feel isolated. As someone who is very Caucasian presenting, I'm also Hispanic, but I was always in the past of looking like everybody else, which was sometimes frustrating to me because I was like, that's something that I'm proud of. But students who are so blatantly see signs of racist tendencies and microaggressions in everyday facilities. I remember this one student was telling me about a wellness room that she had and how she hates it because she feels like teachers pick on her specifically because of her race. And I mean, there's two sides to every story, but you cannot tell a student that that is not accurate. If a student feels that way, if they're being blatantly picked on by even teachers based on the way they look or where they come from or their heritage, I think that's something that I didn't realize was such a huge issue, but I mean, makes sense. I mean, Vermont, it's a very white bread state. And so I remember in high school having one person of color, and that's normal in so many schools. And I think seeing this increase of diversity in our schools means that we're seeing race come up as something that we need to talk about. I know some people are afraid to start that conversation, but I think talking to students who bring up those issues or talking to past students who've had experiences is a great way for schools to be able to identify problems that they can't necessarily see or don't see. So that's a story that breaks my heart, that a student felt like a teacher was, picking her out of a line based on what she looked like. Another story that sounded so similar to mine was a young girl who I think she was a junior or sophomore. And she had such a similar story of struggling to fit in and just giving up. And so I think seeing ways that we can create healthy groups on campus and on schools are a great way to be able to give people an opportunity to get into a safe space of people who either identify like them or feel like they're being ostracized in similar ways. And I know that's hard and it seems like, oh, we can do all these things, but I think that's another thing a story that I heard that I just felt like she didn't feel like she belonged, and neither did I. And there was no place for her to go. So creating spaces that she could go, I think would be an opportunity for schools to make changes. The other question about school visits. So I will tell you, when I first told my director that I wanted to visit schools to talk about mental health, she said, I don't know how you're going to do that. I think it's a lost cause. I would say, there are other ways that you can get involved, find other organizations to work with. And so I reached out to NAMI, and that was a great lead to be able to speak at schools and then give them my business card and say, hi, if you ever want me to come back, I'd love to talk more about a program that I created that I think really emphasizes a lot of the NAMI perspectives in another facet and in a closer knit community. That's one way. So getting into a door through another door of an organization who has already kind of pushed that door open, but it's really hard. I mean, anytime I'm at an event and I talk to a little girl, a little boy, I ask their parents about their schools. I say, hi, do you know a principal? Do you know someone who works in the schools district? And tell them about my program. And that has been a great resource to be able to finding opportunities to talk to schools, but it's not always easy. I've been turned down by many schools, either based on stereotypes of what the Miss Vermont organization is or who I am and what my, initiatives are. I mean, it makes sense. There are a lot of gates around schools to keep them safe and to keep people who are entering those schools, checked in many facets. I think that's so important. But I would say being able to just network and find people who work within school districts and tell them, you know, your initiative or why you want to attend schools or your program and how it's benefited other schools can be a great way to get your foot in the door. But it's hard. I don't have a magic code, but if anyone wants to ask more questions, I'm going to put my email in the chat. It's missvermont2022@missvermont.org. Feel free to message me if you want me to visit your school. Again, this is a great plug to hopefully finding people who will let me go to their school. But if you want to find organizations or schools who will invite you, I'm happy to provide any networking opportunities, because I know it's really hard, especially when you have something that you're like, I know students need this. And when I go there, they're like, whoa, we needed you. And I'm like, yeah. So a lot of facets, but those are kind of my 2 top tips.
Great. Love the relationship building aspect of what you're talking about. Anybody could be an entrance into a deeper conversation with someone, an individual student, a whole school. So thank you for that message. There's a bunch of questions coming through around 2 things. First of all, how to find your publications, how to access the resources that you're working with. That's one question. And since you just offered to put your email in the chat, I'm thinking maybe you will be willing to tell us where we can find and learn more. And then also, what do you see for yourself and your own path in the next 3 to 5 years, or just where do you envision yourself going?
Yeah, so I'll put down in the chat after I'm done talking, and not to distract or waste any time, because we have so many other people who are going to say such amazing things. So the feelbetterway.com is a website that you can buy individual books. Each book that you buy, a book gets distributed to a student in Vermont. You can also donate on that website. But if you want to contact me directly and either order a larger quantity of books or have any questions about it, feel free to contact me on that email, missvermont2022@missvermont.org. And the other facet of your question, what was it? I'm sorry, now I blanked.
Where you see yourself going?
Oh
Yeah.
gosh.
What's next?
I forgot. So my life is in a very transformative time. I think being a business owner, there are a lot of facets that I see of expansion in my business, but I also think about ways that my business can benefit other organizations as I grow and hopefully hire other employees and help mentor other women in design. I think being able to give a proceeds of my profits to a foundation is something that it will always be in my heart, because giving back is so, so important. And there are so many wonderful organizations who are doing such amazing things, like NAMI, like organizations all over the country and the state. And I think that's a major part. I have a master's program that Lori mentioned in the introduction. So I'll be finishing my last year at Boston University. And then I think my life is in a big flux. I'm not really sure what I want to do. Half of me wants to go back to school and focus on a business aspect to be able to understand, because I did not think I was going to own a business, and I came very unprepared and have no idea what I'm doing half the time and just make it work as I go. And so part of me wants to go back to school to study a little bit about how I can grow my business in a strategic way. The other half of me wants to just keep doing what I'm doing and working with women-owned businesses, partnering with organizations like NAMI, because mental health is something that I think is so interconnected in everything that we do. But as far as my life, you know, going back to Boston, finishing school, and then seeing where life takes me, I don't really have a direct answer. And it's weird, because any other time in my life, I think I would have given you a 10-year plan of exactly what I was going to do and when I was going to do it. Maybe that means this is going to be exciting and changes are going to happen. And I have learned to be more accepting about that than I had in the future. Again, perfectionism. It can be really dangerous to have this goal of, I'm going to work in XYZ and then it not happen. And you feel like you have to start over. There's no such thing as starting over. And I've realized that every lead that I've had in life, whether it went somewhere, whether it didn't, or whether it went somewhere for a short time, has always found some way to help me succeed in other facets of my life, whether that's socially, business-wise, in my career. So long, short, I have no idea, and I'm okay with that.
Wow, loaded with words of wisdom there. Thank you for that. Well, you have, I think, like a Zoom room full of fans who are appreciating everything that you have shared with us. And all of your story. Alexina, is just really wonderful to hear. Thank you so much for sharing and opening up to this group. I think a lot has been kind of revealed around some of what our conversation around youth mental health actually means and what it means for the adults in this room, to think about how to be someone that's trusting and seeing through some signs that might always not be obvious. So thank you so much. I just love seeing all these little emojis come through for you here.
Thank you so much, Drew. And thank you all for the comments. I'll try to like stalk people in the little comment section, get back to everyone. But I'll put my contact information in there as well. And I am just so excited for this opportunity. And I am so looking forward to the rest of the day and seeing what we have next. So thank you so much, Drew. And thank you, everyone.
Thank you. Wow. Well, that was so wonderful. Thank you to Lori and NAMI for connecting us with Alexina. Really inspiring. I am pleased to sort of move us in our agenda into another sort of celebratory opportunity, which is to recognize the recipients of this year's Youth Mental Health Advocacy Award. And so I'm just going to give a little nod to some of the folks who are helping supporting tech so that we can make sure that we get to see and celebrate on the screen the recipients of this award. But I'll start by just saying a little bit about what this is. So the Youth Mental Health Advocacy Award recognizes Vermonters of any age who have made a positive impact on youth mental health through their work, achievements, or impact. From their own experiences or on behalf of the experiences of children and youth who are experiencing trauma, substance use, a mental health condition, or an intellectual or developmental disability, recipients of the Youth Mental Health Advocacy Award were nominated for having demonstrated the following capabilities: influencing public policy, so exemplifying passion and advocacy, reducing stigma, improving awareness, inspiring others, and influencing public opinion, overcoming barriers to services, demonstrating commitment to accessing necessary services and supports in the community, or who are nominated for having displayed leadership in local, regional, or statewide groups to successfully impact access to quality services and peer support, informing public policy or improving public awareness and education. So, big time award recognizing major community impact. This year, we are excited to honor 3 people with this award. I will announce each recipient and share a little bit about them from the nominations that were offered on their behalf. And then each of you 3 recipients are invited to come off mute and share a few words in response if you would like to. So here we go. I am totally honored to present Leslie Farrer with the Youth Mental Health Advocacy Award, Chief Clinical Officer at Spectrum Youth and Family Services, who is nominated by Mark Redmond, Spectrum's Executive Director. So Leslie began at Spectrum in 2014, and by Mark's account has overseen virtually all of Spectrum's programs supporting youth. As a result of Leslie's attention to the Riverstone Counseling Program, the number of youth referrals increased from schools, pediatricians, and most importantly from word of mouth. And she grew the program by recruiting and adding more licensed counselors all the way through the mental health crisis of the COVID-19 pandemic to diminish the wait list for support. Her efforts increased the number of youth supported by 66% from 2020 to 2022, which is, totally attributed to her efforts and her commitment to never sacrifice quality for quantity. The quality of Leslie's work is described as second to none and has positioned Spectrum to continue to grow and nurture this program for years to come. Leslie is meaningfully involved in countywide and statewide groups in Vermont that address trauma, mental health conditions, and substance abuse. She serves on the Vermont Addiction Professionals Association as an advocate for the counseling profession, the continuum of care, professional education, and the development of the treatment system. And Leslie recently joined the One Care Board to represent youth and mental health care staff with the intention of innovating how Vermont provides mental health services while making it more effective and cost efficient. Congratulations, Leslie. This was a beautiful nomination by Mark on your behalf.
Thank you so much. I really appreciate the nomination and the award. I'm really grateful for having the opportunity to help people feel better and to advocate for young people and provide hope and save lives. Thank you.
Thank you so much, Leslie. Lots of love and claps and thumbs up coming through the emoji language. Thank you so much, Leslie. Okay, so next, I'm honored to present Cheryl Huntley with the Youth Mental Health Advocacy Award, Operations Director for Youth and Family Services at the Counseling Service of Addison County, who is nominated by several of her colleagues at the Counseling Service of Addison County. You can see that watch party just lighting up with celebration. So I want to name Cheryl's nominators. So we have Rachel Cummings, the Executive Director at CSAC, Bill Claussens, Chief Financial Officer, Alexa Euler, the Director of Human Resources, Sandy Smith, Director of Adult Mental Health, as well as colleagues outside CSAC, including Donna Bailey, the Director of the Addison County Parent-Child Center and co-chair of the Vermont Parent-Child Center Network, as well as Maura Cook, Health Promotion Disease Prevention Division Director at the Vermont Department of Health. Look at that beautiful watch party surrounding Cheryl. So lovely. So Cheryl's nominees describe how her life has been dedicated to creating high quality access to mental health care and ensuring that systems work for kids and their families, regardless of background, ability, or location. She is described as an impactful, supportive, caring, and smart beyond measure leader who is an outstanding role model for others in the field. Cheryl is a leader in creating innovative programs and services that support youth experiencing mental health challenges. Cheryl has developed programs that connect young people with similar experiences, reducing feelings of isolation and improving self-esteem, and family support programs to provide education and resources for parents and caregivers. Cheryl speaks up and pushes others to be family-focused, transparent, and to build broader shared vision. She is described as holding everyone around her accountable to system of care values and whole population thinking, as evidenced by her leadership with the Resiliency Project, Okay, You've Got This, and she spearheaded a movement within CSAC to become a trauma healing agency toward a trauma healing Addison County community as a whole. Cheryl co-created and implemented integrated family services in Addison County, a payment model that focuses on prevention and early intervention of mental health issues among children and families, and which created a collaborative environment among schools, community organizations, and other local partners to address the underlying social determinants of mental health, like poverty, education, and housing. Her partners attribute Addison County's reputation as a community of collaboration to Cheryl and her relational leadership. Congratulations, Cheryl. If you'd like to come off mute and say a few words, you are more than welcome.
Thank you. This really, really means a lot to me. I confess that one of my favorite parts of this work is meetings. It's the bringing together of all the people that care about kids, childcare and schools and healthcare and mental health and DCF, the voices of kids and families. It's the kind of bringing together of everybody that I think offers hope. It's hard to be a kid in this world right now, and probably still harder to be a parent and worried about your kids. Nobody can do it alone, but it's when we all come together and make connections that we feel supported and energized and think creatively about the problems that we share. There's a real power in that and an opportunity to make a difference. Thank you all for sharing in this work with kids and families and in this recognition today. I truly appreciate it. Connecting and caring is what this work is all about, and Vermont knows how to do this. Thank you.
Thank you, Cheryl. Lots of emoji language coming up through the chat, in addition to the actual claps and love surrounding you in the moment. Okay, well, we have one more recipient to honor with this award. I'm honored to present Lance Mateer with the Youth Mental Health Advocacy Award, Program Manager for the Children, Youth, and Families Services Division at Northwest Counseling and Support Services, who was nominated by Danielle Lindley, Director of that division at Northwest Counseling and Support Services. We've got another watch party in here, it looks like. I can see a lot of zooming in happening at the moment. Perfect. Lance has worked at Northwestern Counseling and Support Services for 7 years, where he served in various roles that have all served to support youth and to impact the system of care. Lance's colleagues and partners recognize his genuine commitment, motivation, and tireless efforts to making his community a better place. Belinda Bissett, Lance's former supervisor, had this to say: Lance has led the state toward advancing the work of not only reducing stigma, but enhancing the collective vision of investing in overall community health, particularly for youth. Lance has shown up for youth time and time again. He speaks openly and eloquently about strengths, resources, and areas of growth needed to support youth in our community, in every community. Lance is a dedicated planning member for a local organization called Afterglow, which shines a light on suicide awareness and prevention, and was developed by a family whose teenage son died by suicide. Lance has never hesitated to step up and support the family and event in any way that he can. He has also been a leader of the statewide efforts to bring adult, youth, and teen mental health first aid trainings to thousands of Vermonters, introducing people to the unique risk factors and warning signs of mental health problems. Lance is passionate about the health and well-being of Vermont's youth and has conducted countless trainings throughout Franklin County and as part of his work at NCSS. Lance has taken these efforts statewide, playing a leadership role in coordinating efforts through Vermont Care Partners that enable our state to have as many mental health first aid trainings as possible, as well as engaging partner organizations such as Vermont After School, USCRI, UVM, the Richards Group, St. Michael's, and other colleges, and more to expand reach. And he's also piloted the Teen Mental Health First Aid curriculum in Vermont on behalf of the National Council for Mental Wellbeing. Lance is described as able to rally those around him, noticing the realities youth face and thinking critically and expansively to create meaningful change, all while keeping youth voice central and as a compassionate doer. Congratulations, Lance. You're welcome to say a few words if you would like, and if the technology allows.
All right, well, thank you very much. I definitely appreciate being nominated, and I appreciate the opportunity to do this work throughout our state as well. I think I've met so many wonderful people also doing youth advocacy work and working to reduce stigma and increase our positive views on mental health. So I look forward to continuing to do this into the future, and thank you for the work.
Wonderful. Okay, wow. So why don't we give another round of applause and hearts and celebratory emojis through this our technology medium. Another congratulations from all of us on the planning team and all of us participating in the day today to all of our Youth Mental Health Advocacy Award recipients. We are honored to work with you, inspired by your efforts, and grateful to be able to celebrate not only all of your incredible accomplishments, but your ongoing impact on behalf of children, youth, and families. So thank you. What we have coming up next is a lunch break for about a half an hour before we come back. So I'm going to pause and see if my friends Lori or Julie want to come off mute and say anything before we take a break. But thank you. This has been such a wonderful morning. Okay, well, oh, here's Lori. And of course, I forgot to mention that we have a wonderful slideshow that will be playing during our lunch break. But Lori, please go ahead.
No, I just wanted to say thank you so much to all of the Youth Mental Health Award recipients. And thank you, Drew. This is just a fantastic event.
I can't say I have anything to add. I think it's been a really informative and wonderful morning, and I'm so pleased for the recipients of the Youth Mental Health Award and recognizing the amazing work the three of you have done in our communities and what a difference it's made. So glad to be part of your community.
Totally.
Please
also
take a break, everybody, and we'll be back at 12:30. And we'll be doing the sharing of the stories. Thank you. We'll be starting in about 2 minutes. So just to let you know to get ready. Thank you. Welcome back from lunch, everybody. So sharing our stories is one of the highlights of the day, and people are here to speak their truth. Some stories may be emotionally difficult to hear, and we ask that you take care of yourself as you need to. And in the chat, there's going to be several resources if you do need them. So right now we're queuing up all of the presenters that will be sharing their story. And if you are a presenter and you're still as an attendee, when you get the link, make sure you do accept it so that you can be promoted as a panelist. So please raise your hand if you still haven't gotten to that point to be promoted as that panelist. And we ask all of our presenters to keep their stories to less than 5 minutes to allow everyone who has registered for this session to have an opportunity to share their story. And before we begin, we have a few pre-recorded videos that we would like to play.
War by Scott Brody. Battles for freedom require great effort. Lives torn and ripped apart by the force of the struggle. Victories accomplished and celebration of success. Autism struggle prevents normalcy and demands massive energy just to be. Family, friends, and supporters pulled, shoved aside at times. Unfortunate bystanders of my life. Intelligence glowing through my typing. Bright light of the dawn of communication.
Hello, my name is Christopher Morton, and I'm from Riverside, California. I want to share with you my experience and struggles with mental health, bipolar disorder, depression, as well as anxiety and trauma. I want to make you aware that if you see people out every day smiling and happy, many of them are concealing their struggles. I want to encourage you to take time to have conversations and learn from each other. Listen to each other's stories to try and help encourage people to seek therapy and different types of services that are out there. Throughout my life, I've experienced many traumatic events. My roommate tried to kill himself. I tried to as well. I drank until I blacked out. When I woke up, I was in the hospital for the first time in my life. The doctor let me know that with the amount I drank, I was lucky to be alive. It had such a tremendous impact on my life, so much that I would never drink again. I decided it's not a risk I can take. For myself to improve, I needed to make changes to those who I socialized with. I needed to see who supported me and those who brought me down. I did finally seek therapy, where I was able to share my story with someone and process my pains, my regrets, as well as share my trauma. Today I'm a different person. I have more support, I'm more honest with myself, and I'm more open to people. And I have more pleasant experiences interacting with people, which is different than before. I was aggravated very easily and had a short temper. I've learned one step at a time. One of the biggest lessons I've learned is to let it go. Sure, a lot of people have had similar experiences, but how they resolve them is very different. Mental health is a serious issue today. Some people think it's not a big deal, but it is serious. Please support and encourage each other, contact your loved ones, check on the people that you consider special in your life, maybe their last day or their final breath. We need your support in regards to mental health. Often, people think it's not a big deal, that people with mental health are weak, but it's not. Asking for help is a huge step for yourself, and it helps other people to realize that they can ask for help as well.
My name is Cheryl Van Epps. I'm a resident of Essex, Vermont. 10 years ago, I suffered a complex head injury. The head collision left me with skull fractures, a moderate traumatic brain injury, chronic nerve pain, and mental health issues. I joined patient advocacy organizations at the national, state, and local levels to fight for better patient safety and quality of care. I was not provided the brain injury nor the mental health care that I needed when I needed it most. In the exam rooms of 4 different physicians, I broke down sobbing, yet none of my physicians recommended or referred to me to mental health care. As a result of waiting to see if I improved, I returned to school without any accommodations for unrecognized cognitive and mental health issues I was suffering. My troubles snowballed until I suffered a mental breakdown. These delayed diagnoses and interventions caused my issues to worsen. It wasn't until 5 years later I finally got an adult psychiatric evaluation. They found I suffer PTSD. 10 years later, I am still unemployed. Lessons from my and my peers' similar patient experiences inform us that our primary care physicians, our emergency department staff, other health professionals, sports facilities, and school staff need to improve and gain more knowledge in the area of prevalence of brain injury and mental health issues. We need to recognize the signs and symptoms of brain injury and mental health issues. We must understand the importance of acting upon this knowledge. Right now, we have no idea how many Vermonters had survived a brain injury and currently go undiagnosed and untreated. We know a high percentage of survivors like myself also suffer mental health issues. We also know a high percentage of brain injury co-occurs in incarcerated and homeless populations. So why aren't we screening and evaluating more frequently for brain injury? Why aren't we integrating mental health into our medical health care plans? Our months-long patient wait times are evidence that Vermont, as is all of our 50 states, we're not receiving sufficient federal funding
to meet our patient needs. We patients are asking our leaders to speak up to Congress on our behalf. Where should we invest additional funding? To rebuild our system to capacity to meet our patient needs. To improve health professional training so they can better identify our needs. To invest in frontline workers like community health workers, peer support, peer mentors, patient advocates, to fill in the current gaps in our system. To fund organizations like NAMI and Brain Injury Association of Vermont. To involve patients in policy design and decision-making. As each of us rely on our healthcare system to work for us, we rely on you, our political leaders, to represent us and to fight for our needs. Thank you for listening.
I want to thank Scott, Chris, and Cheryl for sharing their stories with us. We really appreciate that. And just to comment on Cheryl's statement, there are those opportunities to be involved in different committee work, to be able to have that patient voice heard. And NAMI Vermont would be happy to help you in identifying some of those opportunities as well. So now we'd like to get started with some of our live stories. And like I said, please take care of yourself. If you feel you need to step away, please do so. But Erica, if you would like to join us. Hi, Erica.
Hello.
Thanks for being here today.
Thank you. And thank you to everyone who's sharing their stories. My name is Erica Nichols Fraser, and I live in Waitsfield. Growing up in Vermont, I struggled with anxiety and depression from a very young age. I felt like something was wrong with me, and I was ashamed. When I was 13, I developed an eating disorder and was hospitalized in a teen psych ward out of state, as there were no appropriate facilities closer to home. That experience was traumatizing and deterred me from seeking the help I needed for a long time. It wasn't until my 20s, when I was living in Burlington, that I once again sought professional help with the encouragement of my partner. After striking out a few times, I found a therapist who was actually accepting new patients, which is not always an easy feat, but she did not accept insurance. I had to pay out of pocket for as long as I could before discontinuing therapy. Then things got worse, much worse. I struggled through trauma, manic episodes, and depression for several years until I finally went back to therapy and found a therapist with whom I developed a good rapport. There were no options for mental health care in Starksboro, where I was living at the time, so I had to travel to South Burlington to get the care I needed. After a series of prolonged manic episodes, I was finally diagnosed with bipolar disorder 1 at the age of 29. My therapist recommended that I undergo psychoanalysis with her 3 to 4 times a week. Although I had insurance, psychoanalysis was not covered by my provider, and my husband and I had decided to dip into our savings to get me the mental health care I needed. The ability to do so is a form of privilege that not everyone has. Healthcare, including mental health care, should be a right. No one should have to choose between financial stability and their mental health. We managed for 2 years before it no longer became financially viable to pay for this type of care. I traveled an hour each way 3 times a week, in addition to the many hours actually spent in therapy. I feel very fortunate that I was able to make this work, but so many people would not have been able to afford this time, transportation, and expense. Especially in our rural towns, there is a dearth of mental health professionals and other resources, and too many Vermonters have to make impossible choices when it comes to caring for themselves. Those 2 years of psychoanalysis taught me a lot, and generally speaking, I'm now able to much better control my emotions and live a meaningful, rich life. This doesn't mean that there are not still challenges. It took many months of experimenting with medications before my psychiatrist and I found a combination that helped me regulate my emotions, remain mostly stable, and participate in the world. Part of these adjustments involved a cocktail of medications that made me so drowsy, I actually fell asleep at the wheel one morning on my way to work and totaled my car. Fortunately, neither myself nor anyone else was hurt. That accident easily could have been much more serious. I wrote a memoir about my mental health journey and the healing power of food and community. It's called Feed Me, a story of food, love, and mental illness, and was published by Casper Press in December. Since then, I've been speaking to many Vermonters who have experienced similar struggles, many of whom are afraid to talk about their mental health issues with friends, family, or employers and coworkers. They still carry shame and fear about what will happen if people know. I'm actually speaking this evening at the Round Hearth Cafe in Stowe from 5 to 7, and there is a free dinner for anyone interested in learning more. I want people to know that with help and hard work and the right resources, it can get better. But unfortunately, too many Vermonters lack access to the mental health care they need. They lack the resources, the time, and the support so critical to recovery. Too many Vermonters are uninsured, and even those with insurance may still not be able to get the services or medications they need covered. In Vermont, we don't have enough facilities or resources to treat everyone who is struggling with mental illness. We can do better. It starts with us telling our stories and with people listening. I commend those here today who are doing just that. Together, we can create a system of care that supports all Vermonters. Thank you.
Thank you so much, Erica, for sharing your story. We really appreciate that. And especially the insights about the things that we need to fix in the system of care. Getting insurance to be able to have them pay for counseling will definitely help provide that prevention. Our next presenter is Judy. If Judy could join us. Hi, Judy. Thanks for being here today.
Thank you for having me. And I want to thank everybody that's spoken. And I just appreciate all the people from the state that have spoken and shared, what's going on. I'm just really grateful. My experience has been with our daughter. I'm a member of NAMI, and Life with Our Daughter brought us to NAMI, which basically has saved us. She is adopted from Russia, and absolutely adorable little one, but she was 2 years, 3 months and the size of a 6-month-old. She'd been completely neglected in the orphanage and was just a little ray of sunshine that just enjoyed anything and everything folks did. We just felt completely, just everyone was charmed with her. She was wonderful. But as Alexina spoke about, is how easy it is to be bullied and have a hard time. We were very fortunate. People spoke up and said, how do you find the right school? She went to the grammar school in Putney, and they are just amazing. Kids did not feel different. They did not feel left out of things. It was absolutely a delight. But she became a high-level figure skater and also a lot of horseback riding. Riding was up in Putney, then in Guilford. Ice skating was in Greenfield. And we finally said it was such a long drive and commute, and she needed to even skate at lunchtime some days. We went to public school. Totally experienced the things Alexina did, and she literally ran away from school one day, just ran, bolted. So then we went to Greenfield Center School, another private school down in Greenfield, very close to ice skating, another amazing model. So it can be done. So public schools, any school can develop a world of acceptance. So she had did very well there, but she really wanted to go to a big high school, meet more kids, insisted on public school. So we came back to public school in Vermont, and another disaster. She went into a deep depression, and it was probably, going into adolescence. A lot of these things can be triggered more easily. So we had a year where it was all I could do to get her out of bed, and she missed months of school. Finally got her back in, and she caught up and went to the high school she had wanted to go to. She played field hockey, ice hockey, everything. But a lot of bullying. It was stressful. And so unfortunately, in the middle of sophomore year, things went awry in ice hockey, and also, she was a gymnast and stopped that, and everything just fell apart. So she wound up at the retreat. We had multiple crises, and they wanted to send her home. And it's just like everybody has said, where can our loved ones go? Where can they get enough care? So we were very fortunate because HCRS had established a program at a place called Hilltop. Only has 8 beds. But we were very fortunate that our daughter qualified to be accepted there. It's a residential program. It's like a home for young adults with early episodes of mental illness. And it's a therapeutic, non-institutional, home-like setting. It literally saved her life. When she was there for almost 2 years, and they teach you do cooking, you do community service, you do your education, you connect with people. It's totally amazing. And she was able to go from there with a little bit of time finishing up school and graduating off to college. And without Hilltop, we probably wouldn't have our daughter. So one of the big things I advocate for is services for youth. And as someone was saying in the chat earlier, perhaps having someone from HCRS and the different designated agencies embedded in the schools to be there as a support. Because if we can keep our kids well, my daughter was able to get a degree in psychology. She just has a couple classes left now to have her master's in, she'll be a therapist. And right now, in her last year of grad school, she's going to be a therapist at a hospital in the Philadelphia area for alcohol rehab. So she is already giving back. And so if we can have more services, more things like Hilltop, more beds in hospitals, and what does that mean? We need to raise the pay for nurses and people. We need to have housing because how can people come to Vermont to be nurses? And the traveling nurses make so much money that I personally know nurses that have gotten very frustrated and retired. And it's a very stressful work. And we really need to support all of these services, the therapists, the doctors, the nurses, all of them. More funding for places like HCRS has with Hilltop. So I will pass it on for other folks to share, and just once again, thank you for everybody here today.
Thank you, Judy. And I think that really demonstrates how we need those step-down facilities. We need that continuum of care to help people. Okay, next we have Marie will be joining us. If you could come on. Hi, Marie.
Hi, good afternoon. Thank you for having me. And I want to say thank you to everybody else that's sharing their stories. It's not an easy feat to do, but we do it because it's so important for people to hear what we have to say. My name is Marie Lennon. I grew up in New Jersey. At the age of 22, I got married and stayed married for 6 years, which was 5.5 years too long. He was physically and emotionally abusive. I have a 70% hearing loss because of this, and my doctors say that I probably had concussions and didn't know it. I was not able to see my family. I was not able to go to the doctors because he was afraid that if I did, somebody would find out what was going on. On the day I left, my husband was sleeping and my dad was outside waiting in the car. I knew if my husband was awake that I would not get out of there alive. I moved to Shaftesbury, Vermont, where I lived with my mom and dad. A few weeks later, my mom went to New Jersey to visit my sister for a week, and I was at the house by myself. My husband called the house and said he was coming up that weekend, that we needed to talk. My response to him was, I have nothing to say to you. He repeated, I am coming up this weekend, and hung up the phone. I went down to the state police barracks and explained to them what happened, and I showed them the protective order that I had. They explained to me that the protective order was only good in New Jersey, where I got it from. So I ended up going down to the Bennington County Courthouse by myself and getting another protective order that would be good up here in Vermont. And I was very glad that I did. That Saturday morning at around 6:30, the doorbell rang at my parents' house. I was able to see who was at the door through a window in one of their spare rooms. It was my husband with a gun. I called 911, and within 2 to 3 minutes, there were 3 state police cars in my parents' driveway. They escorted my husband off the property and told him that if he came back, he would be arrested. One of the officers sat with me for about half an hour afterwards to make sure he didn't come back and to try to calm me down. About a month later, I saw a doctor and was diagnosed with PTSD, complex depressive disorder, and anxiety. I can still remember the first time
Marie, I think we lost you on audio. Marie? Maybe if you turn off your video and just use your audio.
I have a few hobbies that help. I crochet, I love to read, and my newest hobby is sewing. Since the beginning of the pandemic, I have been sewing face masks and donating them to hospitals and schools. The thing that helps me most when the hamster wheel is in my brain won't stop is music, especially gospel. One thing that I want to stress that is so important is that the need for mental health services. I had to wait for a year on a waiting list before I was able to get into a counselor. And now with the homeless crisis that we have, I can't even imagine how many of them also have mental health issues and don't have the insurance to go to the doctor or a counselor. This has got to be even rougher, having an added stress onto what they're dealing with already. I just want to thank all of you for listening to my story and want to say how helpful NAMI has been for me to be able to tell my story. And the way I feel is if I'm able to help one person get out of an abusive relationship, that's all worth it to me. Thank you very much.
Thank you so much, Marie. And Marie is a volunteer with us and presents for the NAMI In Our Own Voice program and travels throughout the state, or we do it by Zoom, where she shares her story of recovery. And like she said, she really finds meaning and purpose in being able to share her story to make a difference for other people. I'd like to call on Alana next.
Hi, everyone. Thank you all again for this opportunity today. It has been an amazing experience to get to listen to the wonderful work that's going on in the government, as well as the work that's happening in our mental health world. So I'll go ahead and get started by saying hello. My name is Elena Freeman, and I'm from Franklin County. I'm a therapeutic facilitator at Northeast Family Institute in St. Albans as a part of their wraparound program. I'm proud to be here today as an advocate and a voice for the youth and families involved in our program, as well as programs across the state. Today, I would like to share a story that I heard in our own program with you and ask for your support of mental health services. There are more children in Franklin County who have experienced a failed adoption than any other county in our state. Many of these children suffer significant adverse childhood experiences that have led to severe mental health struggles, which often go untreated. As a result of their untreated mental health, many of these children are unable to maintain permanency. Their behaviors over time become too much for their adoptive families to handle. And what many adoptive caregivers struggle to see is the impact of this child's mental health on their behaviors. As an agency, we pride ourselves on the inclusivity of the entire family when treating mental health. We've created our services around the use of family voice and choice. This allows adoptive parents and children and youth the opportunity to engage with providers to help them work through barriers presented by mental health and with the support of an entire team. An example of what a team would look like is that there's a one-on-one community skills worker who works with the child or youth, a one-on-one skills worker for the parent or caregiver, individual or family therapy, respite care, and case management services to provide a clear line of communication across all providers involved with the family. The family becomes wrapped in a hug by a team of providers to help support them and all of their mental health as a whole. I personally had no idea that programs like the wraparound services at NFI even existed before stumbling into this position that I'm so grateful for. The more I've learned, I've quickly realized the value behind a program like ours that embraces the entire family. By shifting the work from just the child and the youth to the family unit as a whole, it creates a level of involvement, engagement, and understanding that doesn't exist in individualized programming. The child or youth sees that they are not alone. The parents are able to be provided with an education and a support to help the family learn to function as a whole, which is critical to preserve permanency and allow children to stay in the community. Since taking this role, I've realized that I need to use my voice for advocacy towards mental health needs and towards programs like our own. But no matter how much I advocate, I cannot change the fact that there are nowhere near enough programs available for mental health in our community. More funding, as well as increased community exposure to mental health services, would allow families to feel less alone. It'll give them the opportunity to access help before behaviors from these youth become too much. It'll save families, save relationships, and create a sense of permanency that these children so desperately deserve. My ask to you, the people who hold the power and control, is to take the time to consider the impact of programs like our small wraparound program, to consider the struggles of the youth in our communities, to reflect upon the importance of an entire family experience, and to increase funding as well as awareness of mental health services. Thank you all for your time today.
Thank you for your important work that you're doing, Elena. I really appreciate how you talked about having the wraparound services for family. Hi, Dan. Welcome. You're all dressed up today.
All set for me to go?
Yes, we are.
Okay. Well, thank you, Laurie. I am Dan Toll, as Laurie just said, head of consulting firm Parker Advisors. Our tagline is Believe the Power of Peer. I'm going to tell my story in 3 parts and then briefly offer 3 recommendations for peer support here in Vermont. So my story, A Tale of Hope, the Power of Peer. Part 1, idyllic and happy childhood and teenage years, accomplishments and fun capped by senior year with good fortune and accolades. After high school, earning a BA and MBA, I went on to a 35-year career in corporate finance and corporate consulting in Connecticut. Part 2, when I turned 35, my world began to crumble. I had my first very enhanced mood episode. As many of you know, I try to avoid pathologizing terms like mania and bipolar. My life became a roller coaster of success and crushing defeats as I tried to perform high-pressure jobs, feeling helpless to tell my employers from fear of discrimination and prejudice. When I reached my lowest point at age 54, I had Parkinsonian symptoms, which turned out to be the side effects from multiple psychiatric meds, divorced from my wife, my high school sweetheart of 40 years, fired from my job, drowning in debt, lost my home, facing the prospect of being homeless and struggling financially just to survive. After 2 years of survival in Connecticut, I decided to move to Vermont to try to start over, a move that proved to be a life game changer. Within a year, I stumbled upon something called a Connections peer support group facilitated by one of our hosts here, NAMI, Vermont. From that very first group, that very first peer support service, my life began a remarkably steep but not unbroken trajectory of recovery. Over time, I was trained to be a volunteer Connections peer support group facilitator and later a trainer of facilitators for the state of Vermont for NAMI. I began doing advocacy at the state level, representing peers like myself with lived mental health experience, including Department of Mental Health's Adult State Program Standing Committee, which Marla posted a note earlier about we're looking for members, and the Mental Health Block Grant Planning Council, as well as Agency of Human Services Mental Health Integration Council. Eventually, I started working part-time as a peer operator for Pathways Warm Support Line and part-time peer service outreach coordinator for NAMI Vermont. Year 3, however, was marked by a dip, as is typically part of the journey of many peers. I had 3 inpatient psychiatric hospitalizations, including staying overnight in Central Vermont Medical Center's emergency rooms ever so euphemistically known Transition Care Area, or TCA. And to get a sense of what this place is, picture an isolation cell in a supermax prison without any exposure to the outdoors for days or even weeks on end. But I recovered stronger. Now, turning 65, I'm the proud founder and president of a management consulting firm, as I mentioned, Parker Advisors, that focuses on facilitating transformative systemic change in the lives of marginalized communities of those with mental health, substance use, disability, and homelessness issues, with an underlying focus, and this won't be surprising, on advancing the powerful peer support model. Currently, my crackerjack team of consultants are working on solutions to homelessness, affordable housing, and the overall housing crisis here in Central Vermont. And our commitment to the community is demonstrated by 10% of the proceeds from our firm are donated to game-changing initiatives to tap the power of peer support. Meanwhile, on a personal note, I have a wonderful partner, more than adequate personal cash flow, and no debt. So what are the takeaways from my story? Well, first, my experience with peer support as a consumer, facilitator, trainer, advocate, worker, and now management consultant has been one of, if not the most powerful engines of my personal recovery. Number 2 takeaway is no matter what mental health challenges and triumphs you or your family member are dealing with, there's always hope. And in my experience, and in the experience of so many other peers like me, there's nothing stopping you from pursuing and achieving your dreams. So to conclude, to not only you leaders and policymakers, but also those who want to drive meaningful improvement here in mental health in Vermont, I offer 3 recommendations to move the needle on peer support in Vermont. And I believe all 3 are both actionable and achievable over the next 3 months with focus and admittedly a stretch. So number 1, a comprehensive peer support strategic plan, which I've already outlined for the Department of Mental Health and the peer support leadership community. Number 2, a cabinet level position within Vermont state government. Think Oksana Davis who's the executive director of the Office of Racial Equity. Like those in the BIPOC communities with whom I stand in complete solidarity, the marginalized communities for which I advocate have, as many of you are well aware, been tortured and marginalized for centuries. So in conclusion, I offer my email and chat, and I welcome any and all questions and ideas on peer support, or if you want to join the peer support action team for change, reach out to me. And thank you for the opportunity to tell my story.
Oh, thank you, Dan. We really appreciate your story and your inspiration. You know, you are a true inspiration for so many people, and we thank you.
Well, it wouldn't have happened if not for you, Laurie, and NAMI Vermont.
Oh, you're too kind. You did all the hard work, Dan, and it shows. Thank you so much. Let's move on to Brittany now. There you are, Brittany. Thank you so much. Go ahead and you can take it away as soon as you unmute yourself.
Oh, I can do it. Thank you.
There you go.
Oh, yeah, muted us. Can you hear me?
Yes, I can hear you good.
Yay.
Could zoom in a little bit, but we can hear you good.
Is that better? Hi. I'm Brittany, and my story starts as when I was born and the struggle to live through the night, and then me being a survivor instead of a victim. I survived through the night. I'm 36 years old, and I've lived through very traumatic events, very hard things. And I wouldn't be here today without the support of community mental health. And where I would be is not, I wouldn't be here. And the more I think about that, the scarier my mind gets. And I just want to say that I have said this to many people in many different times, like many different politicians or at the state house, that it costs, I believe, over $1,000 a day for somebody to be in the emergency room or in the hospital inpatient. And I don't think it costs that much to be in the community with a team of supports around you that show their support. I am a peer staff thanks to an incentive from my boss that said, if you stay out of the hospital for 6 months, I will hire you. It was my goal to start working with in the mental health field. So it was like stay out of the hospital for 6 months and I'll hire you. And it's been a full 2 years since I've been out of the hospital. And honestly, I will not go back because of the way I was treated at the hospital. And I just want to thank all of you for being here today. And thanks for listening to my story.
Thank you so much, Brittany. We really appreciate your story.
Thank you.
And I believe we have somebody else at your same location. Logan would like to also share a story.
Yes, hello. Can you hear me all right?
Yes.
I can't see me, so can you see me all right?
No, we can't see you yet. Did the video, I think the video turned off. We could turn the video back on there. There we go.
Is that all right?
Great.
Hello. I'm the
We're
black
good.
dot in front. So I'll just start off by saying hello. My name's Logan. I'm 31 years old. I was born and raised in Vermont, and I work here at Washington County Mental Health at Sunrise. I'm a peer support. Yeah, I guess I'm just gonna start from the beginning. So pardon me if I take some pauses to breathe. So at a young age, I was groomed by I was sexually groomed by a babysitter, and that went without notice for some time. and it led to therapy for just over 6 years in West Lebanon. I was going about 3 times a week for 4 years, and it was so beneficial because I had one other person who had gone through a similar situation with me, and so I went for another 2 years after that to the same person. And in that therapy, I learned a lot of problem solving skills and ways to react logistically, and it gave me lots of skills that I could apply to my life as I was growing up. However, there was a lot of trauma that went unidentified, and it led to a lot of behavioral issues. And so as much as I was doing well at things, like I was raised in a musical family, so as much as I was doing things well, like learning instruments or being involved in orchestra and performances, I was still misbehaving and getting into trouble, getting kicked out of schools, getting kicked out of classes. I was probably actually not in school more than I was in school, but I had a lot of family that was incredibly supportive, and so sorry. So in high school, I again was very musical, so I was involved in all of the jazz chorus. I was in orchestra outside. I was getting involved in plays in the community, and so I was keeping myself extremely busy, and that was masking some of the symptoms that I was having, because I didn't know if I was manic or anything. I just knew I was having a great time, and I was involved in a lot of activities and kept busy. So I didn't have a whole lot of downtime. Unfortunately, at the end of high school in 2010, my grandfather, Paul Beck, who I owe absolutely everything to that man. He got me involved. He was the musical one in the family and got me involved in everything. In orchestra, he bought me my trumpet. He provided private lessons for me for years. He paid someone to give me private lessons, and he was always sitting in the corner of all of my rehearsals. He was, whether the balcony of the opera house was open or not, he would climb the rope and go up to the top so he could see everything. Little did I know, until after he had passed away, the reason he was up there wasn't so he could see everything. It was so he could see me in the back row playing the trumpet. And unfortunately, it wasn't until after he passed away that I learned how much he provided for me and how much it actually mattered to him what I was progressing in and what he was giving me with the lessons and all of the life lessons that he provided. I learned when it was too late that I had taken his relationship for granted, and that I didn't have the support person around to be musical with. And slowly people started noticing me not being musical, not being active. I was isolating inside. And at the time, I graduated in 2010, and 4 years later, 2014, I was working for the Times-Argus, our local newspaper. It was a great job. Commissions, I was working sales, obituaries, front of counter. I was working in both Barrie and Rutland facilities. I had a long-term relationship. Things were going really well, and unfortunately, I dipped into a depressive. I was less active, so I dipped into a depressive state, and it at one point reached about 2 weeks where I missed my job, and I was calling out sick, making different excuses because I didn't even know what was going on at the time. I thought every day I just said, oh, maybe I'll get over this tomorrow, maybe I'll get over this tomorrow, but then it stretched on for a while to where my job, I walked in one day and they said, hey, we know something's going on and we want you to get help. And that was the first time I'd really heard that phrase. We noticed something's going on and we think you might need some help. And I didn't know what kind of help I needed. But luckily my grandmother, Carmen Beck, she'd show up at my driveway and start honking for the whole neighborhood to hear. So I was forced to go outside, and she was gracious enough to bring me, she knew what was going on. She saw that I was a different person, and she brought me to Washington County Mental Health Services, where I started on therapy and medications, and I was diagnosed bipolar. So my whole crazy time growing up, we just thought we thought I was throwing fits when I was angry, but I knew that no other kid had a tantrum like I did, destruction of property, like I said, doing things that would get me kicked out of schools. And I said, yeah, this is something a little more serious. And so when they diagnosed me with bipolar, that was like a whole new world for me to observe. And I still have my yellow piece of paper with my Neapolitan ice cream metaphor of manic, neutral, and depression, still to this day, and that's almost 10 years ago, and I still have that. And so that taught me my coping mechanisms, my triggers, my symptoms, and unfortunately, I didn't touch upon, unfortunately, when I was diagnosed, I lost that job at the Times-Argus. I lost that long-term relationship I had. I lost all connection with music to the point where I was only listening to it every now and again compared to practicing hours a day, playing all different kinds of instruments, being involved with groups of people. And I was just a completely different person, and I actually saw it for myself. For the next few years, I was still struggling, getting into trouble. I moved down to Virginia to be with my stepbrother at the time, who was a very good support for me. And at a certain point, I felt I was ready, and I came back to Vermont in 2019. I started working for the Good Samaritan Haven a few years before that, and I had to take a break, but when I came back to Vermont, they were incredible enough to let me work with them again. And I was overnight coordinator there and also evening coordinator. So I was overseeing about 30 to 40 individuals of the community who were struggling with homelessness. And I was observing that a lot of these people also, like myself, were dealing with mental health issues, not just struggling with homelessness. Just a few years after that, I actually started working here at Sunrise for Washington County Mental Health, the place that opened my eyes to this other side of my brain. And so I'm lucky enough now to help people that have situations like I did. And that's what helps me right now. I'm also getting involved back with music because with the different instruments I play, like drums is great for exercise. So actually, I'm just going to go through my recovery tips here. For me, it was learning your coping mechanisms, and if you're prescribed medication, take that medication. It might be it's a process. It's not a one ticket solves it all. It's called a process for a reason. We still all have ups and downs. I definitely do. For me, mornings are the hardest because I have to identify what mood I'm in and what I need to do to get my head in the right space to get the whole day going. 2 is exercise. Whatever that is, whether it's walking or, like for me, musically, music is great for physicality and getting the endorphins going. And I'm lucky enough to live in the beautiful state of Vermont, where we have this beautiful snow. I am saying it, the snow is beautiful. I love the snow. I wish we had longer winters. I know I said it. So snowboarding and skiing, that's my winter exercise. When I was going through my time of depression, those 4 years, 2010 to 2014, I was isolating a lot. And so when COVID came back around, I knew not to isolate. It was difficult, obviously, as we all know, but I tried my hardest to get out there as much as I could. And 3 goes along with that, it's staying active. So for me, my new job, I love what I do. I love that I'm seeing services that are provided that I wish that I had when I was going through all of my stuff and I didn't know. So that's what I'm advocating for, is for services like this to be provided and for us to be able to identify mental health issues in the youth so that they can live, so that my children and my children's children can live the fullest and happiest life that they can as soon as they can, instead of struggling. So yeah, thank you for listening to my story. And I just want to also say thank you to everybody else. I wasn't sure if I was going to be able to do this. And so hearing everybody else share their story is a lot. And I'm incredibly thankful to be a part of this group where I know we're all on the same page. And it means a lot to me. And hopefully I can take the tools I've learned, the tools I'm learning now, and the organization and the community around me to achieve my goal, which is someday being able to provide mental health services via music. I would love to do that, and I actually we do some classes here, and I know there are people that are musical here that I've met, and I'm thankful enough to have been exposed to singing and jamming in our side rooms every now and again. And I just look for more opportunities like that. So thank you, everyone.
Thank you so much, Logan. And you're really good at sharing your story. I would love to have you involved with NAMI Vermont and our Ending the Silence programs, where we go to schools and you could share your story with the students. Would love to have you involved, as well as Brittany too. I'd like to move on now to Richard. If you could turn on your video, Richard, and join us. Hi, how are you? You need to unmute so we can hear you, Richard.
How's that?
Great.
Hello,
Yours.
I'm Richard Fales. I live in Rutland. My problems began when I was a teenager. I would stay up all night and do homework and work on the farm and get up early. And I always knew that sleeping like 3 or 4 hours a day, I thought was normal for some age. I then turned risky behavior in high school. I didn't understand. I just thought I was a wild teenager. I got good grades in high school, and I would stay up all night again and work all day. But then in 1996, I went through a divorce, and I ended up in the hospital. And no one knew it was wrong. They just thought I was depressed. So then, in 2000, I had my first mania, and I went to a center that diagnosed me with my illness. And then I was working in corrections, and I worked in corrections for 16 years, and I had several issues, and I went to third shift, and I was comfortable on third shift. And I worked hard and made it to lieutenant. But then I had several hospital stays in between, and it was very difficult going through divorce and the family. And I do want to say that corrections is hard not only on the family but everyone else. And I'd like to speak to someone about training police officers and correctional officers on how to deal with people that are mentally ill in the public and on the inside of the jail. And then I'd like to thank the first responders that came to my help when I had a suicide attempt. I spent 5 months in the hospital at UVM Medical Center. I could only say good things about them. In Rutland Hospital. I I will continue. First responders see everything. Not only the suicide attempts or suicides affect your family and friends, it also affects the nurses, doctors, and EMTs. We got to remember it affects the whole community, not just you. And I have been on several talks, thanks to Laurie Emerson. I would like to train in the facilities and police officers on how to best help people in mental health situations. What helped me first was one officer speaking to me and the other officers not speaking to me. When all officers are trying to give you commands, it doesn't help, it makes the situation worse. So I would like to say, use one officer at a time. And then in corrections, same thing, but it's more difficult in the institutions. But to share, I've taught at the police academy and Bennington, and I'm in our own voices coordinator. I haven't done it yet, so I'm in a report and I'll redo. But thanks to NAMI, I've come a long way. I now work because of my doctors. I've been out of the hospital for 7 years, and I'm very thankful. I haven't used alcohol in 15.5 years, and it's really helped my mental health. But anyway, yeah, I do like to help officers and staff members of the correction facilities, not only to deal with the inmates, but also take care of themselves. I mean, you may know that the officers are working overtime a lot, and I'm sure, I remember working a lot. I remember how it had the effects on me. So we've got to know the signs, and we've got to help them out. And I would like to know.
Thank you so much, Richard. You've come a long way, and you have so much to give with sharing your own story, and we really appreciate that.
Thank you.
So we have another presenter, Margie. Hi, Margie.
Hi, Laura. Good morning, everybody. Good afternoon, as the case may be. I want to give you fair warning. If I'm not able to finish my story, my sister, Kathleen Kelborn, who is also the executive director of Center for Health and Learning, has agreed to finish reading for me. My name is Margie LeMay, and my family has lived in Colchester, Vermont for 30 plus years. I'm a member, volunteer, and an employee of NAMI Vermont, the National Alliance on Mental Illness of Vermont, part of America's largest grassroots mental health organization. My family's story is one of failed systems, struggle, heartache, and profound love. Today, I'm talking about my son, our family, but there are hundreds of others in Vermont who are in one stage or another of crisis. No action can help my son now, but we can change their outcome. Today, I'd like to share with you my 31-year-old son's journey on this earth. Last Monday, we lost him to a lifetime of struggle with mental illness and addiction. Everyone who loves him is both devastated by his loss and comforted to know that his struggle and pain in this life is now over. I'm here to tell you that at every turn in our journey and his journey, every social system designed to help us failed us. The mental health care system, the physical healthcare system, the education system, law enforcement and court systems, and our social service systems. Every one of them underfunded, understaffed, overwhelmed, and stretched beyond their limits, were never able to function smoothly in a coordinated, efficient way, pooling their resources to offer our family the right care at the right place at the right time. The result is that the baby boy we welcomed into our life on October 11th, 1991, with incredible joy and hope, is no longer with us today. The NAMI Smarts training program that I co-teach with Lori Emerson, NAMI Vermont's executive director, teaches people how to write an effective story, how to deliver it to legislators, and most importantly, how to make an ask. I've given a lot of thought to my ask today. The systems designed to fix the problems in Vermont are causing them. My ask is for everyone listening right now, whether you identify as a peer, a family or community member, a provider, or a legislator, please feel and adopt my urgency and help me fix what's broken. We need to start over. We need to design a system where we communicate, coordinate, and make efficient use of our extremely limited resources. Our systems must be generously staffed with people who are paid well, who have a workload that allows them to do what they want to do and focus on providing whole person care from start to finish, supporting and guiding their clients until they are well into recovery. As a society, we must stop. We must step in, stop talking, start doing. How is it possible that my son could drive to City Hall Park and within minutes be approached by a half dozen dealers, all vying to sell him fentanyl? Because the police are so disrespected and reviled that no one wants the job, and far too many positions remain unfilled. How is it possible that my son could be transported by ambulance after a near fatal overdose last fall and then is released within the hour with no one having encouraged or offered a rehab placement or any kind of follow-up care? Because he was physically stable. There was no placement to offer. And there are 24 people in the ER also waiting to be seen. How is it possible that the only way we as parents could get him into a residential placement for mental health as a young teenager was to give up our parental rights and allow him to be placed in a foster home until a placement became available? Because the only placement in Vermont that was available was funded by the state of Vermont and was reserved exclusively for teenagers in the custody of the Department of Social Services. It's important to note, I had private insurance that would have paid 100% of the cost of that placement. My husband and I have just begun to learn how to exist in this world without our brilliant, funny, compassionate, loving young boy. Because despite investing every ounce of courage and resolve that we had, all of our resources, and the love and support of a very large family and many friends, the cycle of crisis. I'm sorry, I've lost my place. Please bear with me. Despite all of that, the systems designed to help us failed us every step of the way. I implore you to help me fix this now, before we lose any more people that we love. Again, today I'm talking about my son, my family, but hundreds of our neighbors, friends, and loved ones are in the same cycle of crisis right now. Help me change their outcome. I don't want to hear one more person say, I'm so sorry for your loss. I want to hear you say, I hear you, I see you, I feel your pain. How can I help you fix what is broken?
That's very difficult to go through, Margie. And I think many NAMI Vermont families understand and feel your pain. We have all experienced similar circumstances. And we have great love for you. You're a strong woman. But your son deserved more, like all the others. And we do need to fix things. And we need to be better about it. We have great love for you and for everybody here who can share their story to hopefully build that resiliency in people and to have hope. I know it's difficult to move on from this one. My heart is very heavy. I do want to invite people, if they would like to share any stories, by raising their hand. We do have some time left before 2 p.m. And if anybody did want to raise their hand, we can put you in and you can share your story too. So I see Marla's hand is raised. Could we get Marla over here? And Marla, if you could just join us, turn on your video.
Hi.
Hi, Marla.
First of all, I want to say the last share really had me in tears, and
yeah,
just just so much compassion and love, and I fully agree that the system is extremely dysfunctional. There are so many caring people, and I feel like the word stigma is a part of the problem. Like the stigma causes more stigma. But yeah, I mean, but for the grace of God, there go I. I mean, I'm a one-time suicide attempt survivor in recovery from drug and alcohol abuse and bipolar, you name it. I was homeless 20 years ago. And I feel like as some earlier shares were talking about, this masking or concealing or, this happy face culture that we're in, just happy face, happy face. It's really not serving us, because to be vulnerable and to be open with safe people is to begin to heal. And
absolutely.
I feel my heart's been broken many times, and not the same loss as Margie, but Vermont's a great state, and allegedly we're #1 in mental health, access to mental health. And anyone who's working in mental health knows that there are still so many problems. So if Vermont is #1, like what's going on with the rest of the country? And I think we all need to come together and in my worldview, say some prayers for healing. So
absolutely. Yeah. And there are a lot happening with youth today, and how do we help them? And I think this Mental Health Advocacy Day really highlights that a lot of times kids are struggling, and how do we change things for them that they are asking for help? They're supporting each other. You know, that's how we heal, is by talking about it.
Thank you, Lori. God bless everybody. Thank you.
Thank you,
I'll stop
Marla.
my video now. Thank you.
Is there anybody else that would like to speak? You can just raise your hand and we can move you over into story sharing. You know, I want to thank everybody for coming out here today, and I want us to carry on this message of hope, that we can change things going forward. And the more we keep coming together and raising our voice, we can do that. We need to be a united coalition completing this work. That's how we're going to get things done, because there are a lot of caring people here. So I would like to call back Drew and Julie. So thank you so much for being here today. We really appreciate everybody coming together. You know, we're looking to have some legislative testimony all scheduled this week. We've created a list for every single day. We're providing testimony to different committees. And we hope that you will all join us, because all of these testimonies will be live streamed. And I'm going to send out to everybody our list with the agenda with people who will be testifying, but it doesn't stop here. Everybody's voice needs to be heard. We all need to be going to the State House. We need to let the governor know what we want and what we need for our children. So I am hoping that we can all join together and be able to go to the State House. There will be a resolution read for Youth Mental Health Advocacy Day, as well as Mental Health Advocacy Day. And I don't know that we have the exact time of when that's going to be, but we can let all of you know, and I hope that you will come to the State House and we could be in the balcony together when the resolution is read in the House. Did you have anything to add to that, Julie?
I just want to thank everyone for coming today, participating. For those of you who told your stories, I think you can see that we're very moved. We appreciate what you've been through, feel what for you and what you've been through with your families. This is serious stuff. This is heartbreaking stuff. And sharing those stories is just so important. So I urge you to share those stories with your legislators. And I know that I spoke specifically about, you know, please fund the community mental health system, but you may have other ideas about what's most important for legislators to hear and what you think is most important to support your fellow Vermonters, our children, our youth, families, people who are older. I mean, there's a lot of people who are struggling with a lot of challenging issues, co-occurring mental health and substance use, challenges with health, traumatic brain injury, intellectual and developmental disabilities. There's a lot of difficult things that people are dealing with. And our legislators, you know, they may have come in because they really want to work on climate change. Very important. They may not know anything about our experiences and what's important to us. So you can go to the legislative website, look up your legislator, look up the committees that are working on the issues that matter. Do know that there are a number of legislators who are hopefully still, I can't say exactly who's listed, but I know particularly the House Healthcare Committee had made a commitment to listen today to your stories, and this will be available to them. So it's an ongoing process, and there are things like budget hearings. You can come when they have a budget hearing. You could I'm sure NAMI is keeping you informed. VAMHAR, Vermont Care Partners, has a legislative update we send out every week so you can know what's going on. And we'll announce when there's a budget hearing. And you get all of, 2 or 3 minutes to talk. But if 15 people show up and talk about these issues, it has an effect. If a legislator hears from 6 people in their community that this is a top priority and really critical to them, it has an effect. So you can make a difference. And today, I think, helps make a difference. And it's something that we need to continue to work on together. So thank you for being here. Please feel free to use me as a resource. My email is julie@Vermont Care Partners. And I know that lots of folks here want to be a resource and help each other. So let's do that and support each other, and hope we can make some progress, because we can't lose our youth. We can't lose our neighbors, our friends, our family. We need to be there and support each other. So I'm glad to be part of this community and support the amazing work that's being done, and to understand that it's not enough and there's more to be done. And I'm committed to play my part in it. Thanks.
Thank you, Julie. Yeah, I mean, I want to echo a big thank you to all the state leaders who were here earlier in the day, sharing some of their perspective. I want to thank Alexina for her powerful keynote address, and Leslie, Cheryl, and Lance, the recipients of the Youth Mental Health Advocacy Award, for all of your work and continued impact. The nearly 60 co-sponsors for this event, I mean, huge support and sense of collaboration in this work. Lori and NAMI, the whole team at NAMI, for holding this together. Julie and Vermont Care Partners, and all of my colleagues at the Vermont Association of Mental Health and Addiction Recovery, and all of you who participated. I mean, earlier today we had, I think, 200 people present together, which is huge. And I think I'll just say that some of what I'm taking away from this day is just the power of feeling seen for our real internal experiences by each other, by professionals, and in the design of systems as well. Just the foundational importance of connections and relationships in which we feel taken seriously for all the different parts of ourselves in crisis and in resilience over the long journey. I will not forget Margie saying that the systems designed to solve the problems are creating them. And I think I'm probably not alone on this call in hearing that. We need systems of care in Vermont that are healing centered and abundant to meet the needs of all Vermonters, especially young Vermonters, exactly where we all are. And I know, looking at this participant list, how many people here are diligently working within these systems to try to change them. So something else that I'm really sitting with is just how inspired I feel by the transformative power of peers and peer support, how we can become connected to each other, and the commitment from all of you participating today to listening and showing up and showing so much love for each other in the stories is basically the spirit that I think this better system we envision is built from. So thank you everybody for participating today.
Thank you so much.